Good morning and welcome to the third meeting of the Joint Interim Standing Committee on Education. Ms. Rowe, will you please call the roll?
Senator Buck. Senator Dondero Loop.
Here.
Senator Lang.
Here.
Assemblywoman Anderson.
Present.
Assemblyman De Silva. Assemblywoman Hanson.
Here.
Assemblywoman Hardy. Chair Bill Ray Axelrod.
I am here, and please note any members who arrive late that they are here when they arrive. Before we begin, I'd like to mention that committee staff will be sending out a solicitation of recommendations in the coming days. This asks interested parties to provide additional recommendations in writing for possible consideration during the committee's work session. Please submit any recommendations no later than June 28th, 2024. Next, I'll cover some housekeeping reminders. The members, for those members and those who are here to provide testimony, please set electronic devices to silent when speaking. Identify yourself for the record each time you speak. When testifying, turn on the microphone and off each time you finish speaking. Sign in at the table near the entrance at each location, even if you do not plan to testify. Meeting materials received prior to the meeting have been uploaded to our committee webpage. You can receive electronic notifications of the committee's agenda, minutes, and final report by signing up at the Nevada Legislature's website. Mute your microphone when you're not speaking to minimize background noise. And finally, please note that during the committee meeting, the Zoom chat feature is only to be used for technical assistance from broadcast and production service colleagues. I will take a 30-minute break around noon. With that, let's get started with our first agenda item 2, which is public comment. Public comment may be provided in several ways, including in person, via phone, email, mail, or fax. Detailed instructions to providing public comment are listed in the meeting's agenda. Public comment is limited to 2 minutes per speaker. In addition, there's opportunity to make public comment at the end of the meeting. LCB's broadcast and production service staff will interact with those making remote public comment and providing testimony to facilitate participation in the meeting. I'll begin with those wishing to make public comment here in Las Vegas. Is there anyone wishing to make public comment? Not seeing anyone come to the table. Carson City? Doesn't look like there's anyone in Carson City. I'll now go to the call-in lines. BPS, please add the first caller with public comment.
Thank you, Chair. The public line is open and working. However, there are no callers at this time.
All right, we will move on to our next agenda item, approval of the minutes. They will look at the meeting minutes from March 20th, 2024. Do I have a motion for approval?
So moved.
Thank you, Senator Dondero Loop. Second? Second by Senator Lang. Discussion on the motion? All in favor? Aye. Any opposed? Motion carries. Okay, agenda item 4. We'll now hear from several stakeholders on the mental health and wellness of Nevada pupils, updates, trends, and methods of addressing chronic absenteeism. We will take questions and answers after they've all presented. To start, I would like to invite Yvette Williams up to the podium. We did have some speakers who are not going to be able to attend, so we thought Yvette could come and give us a little overview of what's going on with Hazel Health. Thank you. Begin when you're ready.
Thank you, Madam Chair, and distinguished committee members for allowing us the opportunity to share with you today. My name is Yvette Williams, and I'm chair of the Clark County Black Caucus. And as many of you know, we have been working in this area of not only mental health, but health for all children in Nevada. We would love to see our state provide free access to health care and mental health for all of our young people. That's still a dream, but we're getting closer. And so it would be negligent on my part if I didn't acknowledge, before I get into this a little bit more, is to acknowledge CCSD and their attempts to address this by providing mental health access through Hazel Health, which is the largest telehealth provider in the nation. And every student in CCSD currently has access to a therapist, so they're not having to wait months to get to a therapist. And so there are other providers in CCSD providing this as well. But during the 2023 legislative session, Senate Bill 72 requires the Joint Interim Standing Committee on Education to conduct a study concerning the mental health and wellness of pupils in this state and programs to improve the mental health and wellness of such pupils, including, without limitation, evidence-based mental health therapies and practices, and to report to the legislature your findings and recommendations for legislation to the Director of Legislative Council Bureau for the 83rd session of the legislature on or before February 1st of 25. After reviewing the meeting agenda, it's obvious, though, that this item does not take a deep dive into programs to improve the mental health and wellness of such pupils, including, without limitation, evidence-based mental health therapies and practices at this particular meeting. It would be unconscionable to provide a committee report without hearing from actual school-based providers currently delivering direct real-time behavioral and mental health services to students. One of the things I did notice in the handouts today, just to give you an example of why I'm so concerned, is in one of the handouts I received, I was looking at, and it shows support that currently exists in Nevada. And there's a big void there. So much is missing that you're not aware of. And so in order for you to really get a grasp on what's going on and the work that's really being done, you need to bring everybody to the table. And that includes those school site providers. And I don't see any. So I'm representing Clark County Black Caucus today as an advocate, and not Hazel, but I am going to bring it up because they are providing most of the services for the students. Having advocated for statewide health and mental health services for students for nearly a decade, I'm very familiar with many programs available to students, particularly in our largest urban district, Clark County School District. If the intent is to analyze programs and practices per the agenda item description, in my opinion, there is a substantial void in your planned presentations from those professionals on the front line. Actual outcomes, data, observations, practices, barriers, etc., would best be informed by those actual school-based providers on the ground and providing direct real-time behavioral and mental health services to tens of thousands of students. Therefore, we would ask that this committee schedule an additional presentation from Clark County School District and allow them the opportunity to showcase the impactful programs they have implemented to address behavioral and mental health needs, provide actual data, student outcomes, return on investment, best practices, and their recommendations for overcoming any barriers or challenges students face in accessing care. Further, it's my opinion that this committee will benefit substantially from hearing directly from these providers and allow you the opportunity to ask qualifying questions and better understand and analyze student needs, best practices learned, and return on investment, where dollars are best spent to achieve legislative goals and outcomes. For example, I've provided a recent independent third-party study by Crimson University's Center for Behavior Analysis that is available to the public. Key findings from the Clemson Center for Behavior Analysis include, and I did provide that all for you, the overwhelming majority of participants experienced a clinically significant reduction in depression and anxiety symptoms, with 75% falling into a lower level of clinical severity, as defined by the PHQ-9 and GAD-7 scales following treatment. The largest improvements were experienced by participants who exhibited more severe symptoms prior to treatment. At intake, 60% of participants in the sample exhibited moderate to severe symptoms. At discharge, only 30% of the sample exhibited moderate to severe symptoms. In other words, after completing treatment, nearly 70% of the sample exhibited only minimal to mild symptoms that place them in the green zone that is considered below the clinical threshold for a depressive or anxiety disorder. In the February 2024 press release that I've given you copies of, Hazel Health expressed their future plans as a result of the study. And this is a quote: "As for the company's future research plans, this is just the beginning," said Dr. Travis Gales, Hazel's chief health officer. "This initial analysis focused on the adolescent segments of Hazel's K-12 patient population due to the age appropriateness of the PHQ and GAD screeners. But a growing body of research on youth mental health is clear. The earlier we intervene, the more we can impact a student's psychosocial and academic trajectory. With over 40% of Hazel's patients in elementary school, early intervention is a foundational tenet of our clinical model, and we will continue to conduct research that enables educators, providers, and policymakers to meet the evolving needs of our children across developmental stages." And I wanted to mention that because there's still a lot of research being done and studies being done. And so there's a lot still for everyone to learn, including us and including you as policymakers. So I wanted to just stress that this is work in progress. And so many of you have heard our pleas to address the need for sustainability moving forward. This is very much a concern of the entire community as we contemplate the end of ESSER funding in 2025. What will be the plan for Nevada to continue providing this critical care to our students that consistently remind us in our work with the Black Student Union Network, which is currently 1,200 plus students in 44 middle and high schools in Southern Nevada, that their most important priority is their mental health? Since the return to campus from COVID-19, many of our students in BSU are serving as peer-to-peer ambassadors through our Mental Wellness Ambassador Program in partnership with our CCSD school-based telehealth provider, Hazel Health. Student ambassadors help their peers learn and access mental health professional services available to them on campus, including walking with them to the school office or sharing the request parent approval form via a QR code on their phone. Sometimes students need encouragement from their peers to seek help. Recently, at our CCBC-sponsored Student Summit, CCSD, through their Equity and Diversity Department, provided 6 breakout sessions engaging approximately 120 of our students in restorative circles. These are restorative circles that are taught to teachers, educators. And these students had the opportunity to experience the power of this practice. Additionally, students have expressed their desire to take ownership of their own mental health. Not only did they enjoy learning these techniques, but I've noticed more interest expressed by students in pursuing a career in mental health. And there's a lot that CCSD is, we're having some conversations about around that particular area of a pipeline for mental health professionals, and in particular, with the BSU, to be able to engage students who are underserved and underrepresented in that particular field. So these are stories and best practices you won't hear about unless you bring folk to the table that are part of this amazing ecosystem and are seeing some great student outcomes and success. This is the investment Nevada can make in our future, in our youth, for our community health. Additionally, since the agenda item refers to Senate Bill 72, which also requires other analysis, we must consider that some of these trends may also be served through behavioral and mental health strategies. The CCBC is no stranger at the legislature on these issues, and we humbly ask when this committee places this item on this agenda that we have an opportunity to present our perspective since the legislature implemented the new funding formula. If Nevada is serious about addressing the many disparities in its education system, it's going to take courage and a willingness to put old, established methodology, interpretations, and practices behind us and move forward with innovative strategies committed to truly achieving a more equitable and just education system where every student has access to success and achievement and not only select groups. In closing, thank you for your time and consideration. We remain available to any of your committee members with questions or need clarity of our position via our email, and you have that in my testimony that I sent in to the secretary. So thank you so much,
Thank you,
and I
Glenn.
appreciate this opportunity.
Thank you for being here. Next, we will have Robin Reedy, Laura Yanez, and Abby Fredenberg Bernhardt with the National Alliance of Mental Illness Nevada. They are in Carson City. Thank you for being here.
Thank you for having us.
Begin when you're ready.
I'm Robin Reedy. I'm the Executive Director of NAMI Nevada, and with me I have Abby Bernhardt and Laura Yanez. Abby is one of our newest members to our state board, and she's representing as chair of our youth committee. So we'll first hear from Abby. Abby, please.
Good morning. My name is Abby Bernhardt. I am a youth peer support specialist, a NAMI advocacy and policy board member, and most recently, chairwoman of the Youth Advocacy Committee for NAMI. Thank you for allowing me to share my thoughts today. At 3 years old, I was diagnosed with bipolar disorder. Starting school was very difficult. I had so much anxiety, sadness, and anger all at once. I felt like I could spin like Taz from Looney Tunes. I could spin right through the classroom, clearing off the desks, bookshelves, while laughing because I was manic with no outlet. No one really had a true understanding of how to help me. And they didn't ask me one simple question that would have really helped. How can I help you? Even a 5-year-old can answer this. I was instantly outcasted and alone. Later, leading to depression and a suicide attempt at just 10 years old. Youth peer support specialists should be hired to work under a school social worker and meet with students weekly, as well as after-school support groups. Lived experience provides security, understanding, and compassion. And it takes away loneliness. When I was younger, I wish there would have been peer support specialists. If I could have seen someone with a similar mental health journey that was successful, I would have instantly had more hope. If they can do it, so can I. Also, NAMI's Ending the Silence needs to be implemented into school assemblies so that children know they are not alone and we're talking about mental health because the stigma and shame is real. And talking about it will save lives. We need our educators to be trained in ASSIST, Applied Intervention Skills Training. When I was in school, I was often seen as a disruption. For not understanding something or asking a question, I would be called into the principal's office and told I was hopeless and helpless and never going to amount to anything, reiterating the idea that my life was never going to get better. Suicide is the second leading cause of death for ages 10 to 25. If our educators are ASSIST trained, this would help equip them with compassion and understanding of how to help someone who is in crisis. Therefore, not contributing to a suicide attempt or further isolating them. Thank you.
Thank you, Abby. And now we have Laura Yanez. She's the Executive Director of the NAMI Western Nevada. Laura?
Thank you for the opportunity to share about some of our programming today. My name is Laura Yanez. NAMI Western Nevada covers primarily 12 counties of rural Nevada, although we do have some statewide programs. Those programs include the Warm Line, the Nevada Teen Text Line, the Chat, as well as Nevada Caring Contacts program. The ones I'll focus on today are the Nevada Teen Text Line with chat feature, as well as the Nevada Caring Contacts Program, which has been awarded an award through SAMHSA for innovations in recovery. So we started the Teen Text Line in 2022, and it was a concept that we were interested to see how it would work for Nevadans. The first year of our Teen Text Line, we exchanged over 74,000 text messages with youth. We currently are exchanging about 10,000 text messages per month. So those numbers have continued to go up. As of May 1st, we will be open 7 a.m. to midnight. The reason that we're open until midnight is that we found that a lot of students between the times of 10 p.m. and midnight were reaching out to the text line for harm reduction. So they were reaching out for having the urge to use substances or to self-harm. In order to meet that need and to be responsive to what our communities wanted, we added the additional hours. The Teen Chat launched in November 2023. It is an innovative approach that is providing equity of access by allowing students to use school-issued technology to connect to a youth peer support specialist. Interestingly enough, 29% of the Teen Text Line participants are located in rural Nevada. So it's been very embraced by rural Nevada. Of those students who've texted in throughout the state, 89% of youth said they didn't know where they would go for support if the Teen Text Line wasn't available. While we definitely encourage them to talk to a trusted adult at school, ask if they've spoken to their therapist about it, and connect to them to resources, that's still an alarming number of youth that do not know where to go. The Teen Text Line is unique in the nation because it is an inbound, meaning youth can text in, as well as we text out based on referrals, and it's a non-crisis peer support line. And by peer, I mean authentic peer support of 18 to 28-year-olds providing support to the youth. We found that 12 to 14-year-olds were utilizing the Teen Text Line the most, with our youngest participant being 8 years old reaching out to the line. We originally were 14 to 24, but because of meeting the needs of the community, we dropped the younger age, or we dropped the beginning age in our available full lifespan. Of the most common reasons for students calling in, the top 4, one is just peer support and a check-in. This can be, I've had a rough day, I got in a fight with my parents, I just had a great day and I wanted somebody to talk to about it. Number 2 is mental health, including anxiety and depression. Number 3 is family relation issues and social isolation. We find that a lot of our students are calling or texting in based on they have no friends at school or nowhere to connect. They eat lunch in the teacher's office. They are having challenges with their parents, including being able to access mental health care. And the last that we have in our top 4 is self-harm and substance use. So these are the youth that are most at risk of either making a suicide attempt, cutting themselves, or other forms of self-harm or substance misuse. The success of the Teen Text Line is really a collaborative effort, but leading the effort was youth who had experienced onset of mental illness prior to the age of 18. Their shared lived experience provided a program that met the needs of youth where they were at, as well as meeting the needs of the community to have that resource. So some of the things that we have success on is building programs that are relevant to the participant. It's challenging to talk to a 12-year-old because they feel like they're experiencing suicidality. One of the things we do is we make sure our operators are well trained. They receive over 100 hours of training, including assist training, Suicide Prevention 101, Youth Mental Health First Aid, and they are state certified peer support specialists. The other program that we are involved in is called the Virtual Crisis Care Program. And I've had the opportunity to go out and speak to law enforcement, whether it's sheriff's offices or PDs throughout the state. This is a program primarily focused on rural communities that allows law enforcement to bring in a clinician in real time, not waiting 2 or 3 hours, to be able to do an assessment as well as build a safety plan. This has been an incredible interest from our law enforcement, specifically school resource officers that feel that they don't have any resources and they're not sure what to do when a student's experiencing a mental health crisis. So based on my experience with running the teen text line, the chat, and the virtual crisis care program, some of my recommendations would be, 1, utilize youth as you're developing programs. It's really important that you have the end user at the programs. As adults, or at program development. As adults, I can tell you great ideas and programs that I think would be wonderful. But if the youth aren't going to engage in it and you don't have their buy-in, then it's not going to move forward or create the impact that we're hoping for. We have a lot of youth advocates, such as Abby, in our communities. I have personally 12 staff on the teen text line that would love to have a voice and help youth get the services they need. Continue the expansion of the teen chat line and the text line. We know that it works. We know that it is diverting crisis, as well as we know that students are receptive to that support. Increase the youth or the use of youth peer support specialists. Again, that is providing authentic peer support because they are close in age to the participants and they have that shared lived experience, much as Abby was saying regarding just knowing somebody else had been there and had made it through. It inspires hope, it encourages engagement in treatment, and it also helps the person have a direction, knowing that they too can recover. And finally, I would say to continue the funding for the virtual crisis care program. This is critical for school resource officers to be able to have an on-site assessment in real time so that they know what is the best course and if a safety plan can be made with the youth, and that safety plan can be encouraged by the school. We definitely have found that our partnership with the Department of Education and Safe Voice have been a great asset, as well as Mobile Crisis Response in Washoe County and the WIN program. Without our community partners and working together, our success would not be possible. Thank you.
And if I can you just give a little bit more detail on the VCC program so that they're aware of what that really is, the logistics of how that works?
Laura Yanes, for the record, yes, the VCC program is when an individual experiences, or in law enforcement encounter an individual they believe is experiencing a mental health crisis. They activate the Avel e-care program through a hub. Avel is a virtual hospital. Within about 3 to 5 minutes, they are connected with a nurse practitioner with experience in mental health. Their nurse practitioners have over 300 years combined experience. They engage with the participant, they do a crisis assessment and a safety assessment, and then they work to engage the person in creating a safety plan that will work for them with the resources they have. If for some reason the safety plan doesn't work, somebody chooses not to engage, then they also make a recommendation if a person should be taken to a hospital. Then there is follow-up care from the teen text line, as well as mental health providers.
So again, Robin Reedy, NAMI, Nevada. So very simply, the person engaging, whether it's law enforcement or a resource person at a school, has a laptop, an iPad of some kind, and can go into this system, and then they can be dealing with the individual virtually, but right on site. Thank you, Laura. So again, thank you for having us. On behalf of NAMI Nevada, the state chapter of the National Alliance on Mental Illness, we are dedicated to support, educate, and advocate for those living with a mental health condition and the families that love them. As you have heard from Abby, NAMI Nevada's chair of our Youth Advisory Committee, there are many examples of programs and training that would positively impact our youth in a school setting. Laura Yanez, as ED of NAMI Western, has implemented statewide services that provide a resource to school-aged children. The Teen Text chat line connecting with young adults that have a lived experience, the CARES program, and forming youth mental health committees within the schools themselves. Giving kids a voice, all will help mitigate the epidemic that we are seeing. Training for our hardworking and underpaid teachers, just as our law enforcement has had to change their education because of mental health issues encountered in the community, so must education. Teachers and administration need to take assist training for suicide recognition, basics for professionals to understand the signs and behaviors in youth of a mental health issue. Programs offered by the Children's Cabinet to identify and treat our youth. But I just have to make sure that everyone really understands that all the data that you hear are reported statistics. Most addiction and mental health issues are suffered in silence, in the dark. The stigma related to these issues does not lend itself to bright light. How many people here have had some form of anxiety or depression, especially during COVID? How much of what we are seeing in our youth is from that time frame? Mental health is a continuum that we are all on, and we can be anywhere on that continuum at any time, at any point in time, whether chronic or acute. The only time it really becomes a statistic is when it's a crisis. Very simply, what I have seen is at least 1 in 3 or more people with the issues that we are looking at today. I would hazard a guess that if you look to your right and you look to your left, either they have lived with it or it's you. 78% of people with an addiction issue are probably self-medicating. Once people are addicted, 100% have a mental health issue because of substance abuse. Mental health issues affect our brain. Our brain is part of our body, and we need to treat mental health issues on par with any other physical health problem for everyone. I once had a governor yell at me to stop saying this. It's so negative. I'll stop saying it when it's no longer true. Nevada is typically ranked dead last when it comes to mental health services in this state compared to the rest of the nation. Where we are not ranked last, you will find an asterisk saying some states were unable to report because of COVID, or don't compare this with past reports because the baseline has changed. Our advocacy issues are developed based on the number of issues brought up in conversations, helpline, warm line, teen text chat line calls, but they generally fall into 5 groups: housing, medication barriers, criminalizing mental health, and the lack of providers with parity and the need to increase services for those living with mental health conditions, especially for the youth and the elderly. Nevada has had studies, work groups, and anything else we could come up with that doesn't cost money. Even the regional behavioral health policy boards will only bring a BDR that doesn't cost money. Now is the time to invest at the front end so that we can save crisis dollars on the back end. Early intervention is what works. We need to spend money to save money. We need to recognize that the money we save will not be in the same fund as the money we spend. SB 167 and SB 177 passed in the last legislative session. It is still not being implemented. Medications are still being denied to individuals whose lives are at stake, including children. This investment in our citizens will save law enforcement costs, indigent expenses for local governments, and most importantly, lives. How many years of your child's life are you willing to give up? Or is it your sister, your mother, or your neighbor? Thank you again for allowing us to speak.
Thank you, and we are going to wait questions at the end, but I just did want to say thank you all for being here, and to the young woman who went through so much, I just thank you for being here, and thank you for being courageous, and it does help. It does help when people see someone that looks like them who's come out on the right side. So we're so happy you're here, and thank you for your courage. Okay. Next, we will go to Dr. David Demora, Dr. Michelle Paul, Dr. Sarah Hunt, Dr. Kellyanne Beavers with the University of Nevada, Las Vegas. Go Rebels. I wore my Rebel red.
Thank you, Chair and Committee, for having us today. My name is Dr. David Demore. I'm the Executive Director of the Lindsay Institute in Brookings Mountain West. Just a couple of little background about us. So we are, Lindsay Institute was formed in 2009. We are a donor-funded public policy center at UNLV. We have 6 primary areas of research. We look at education, economic development, governance, health, nonprofits, and social services. We either conduct our own research or we commission research to essentially frame policy issues to make the case for policy interventions. Some examples of some recent work we've done: we commissioned a piece by Brad Wimmer over in economics to look at how the state might want to deploy its broadband dollars, as well as an analysis by Trip Umbach looking at the economic impact of UNLV Academic Health Center. A lot of our work is disseminated through what we call the Data Hub, and these are essentially fact sheets and data visualizations that essentially extract data from national reports focusing on the Mountain West, Nevada, and Las Vegas. Across we have 11 different collections there, and since we created this right before COVID began, we've had over 45,000 downloads, so I encourage you and your colleagues to make use of this resource. Within the health collection, we have 3 fact sheets focusing on mental health there, one looking at the overall state of mental health in Nevada and the Mountain West, one looking at youth mental health, and also then looking at the issues of provider shortages here. And I want to just briefly highlight some of the data here that's going to create the context for the presentations that follow. So first, as was noted, Nevada is ranked last because of the high need for mental health services and the dearth of providers here. So these data are a few years old, but there was another analysis put out, I think, last week or the week before that essentially tells the same story there. And across the Mountain West, you see the Mountain West does really, really poorly on both metrics there. Specific to youth mental health here, these are some data looking at 2015 through 2022, looking at youth who have report one major depressive episode. So over the time period here, you see the jump in there across the Mountain West there, and you particularly see the uptick during the 2020 due largely to the issues associated with the pandemic there. Focusing a little bit on a little more on the youth and the issue of depression here. So roughly 8% of K through 12 students in Nevada have major depression, and only about a third of the students are getting treatment. Yeah. And then looking at some of the issues that were raised earlier about the workforce in there, and like many of the states in the Mountain West, Nevada lacks the school-based workforce to support the students here. So if looking first at psychologists to students, the ratio is expected to be about 1 to 500, about 1 per school here. We are about 1 to almost 2,000 is our ratio in Nevada. When we look at social workers, about 1 to 250, so think about 2 per school. You're looking at 1 turns almost 9,000 in Nevada. So that simply not having the resources there. And then the last point I want to highlight there, and this isn't specific to mental health, but Nevada has 61 designated mental health care professional shortage areas here. And among the Mountain West, we would need the most new providers to essentially get our ratios in alignment with national expectations, which are about 30,000 to 1 in terms of psychiatrists there. So earlier this month, we held a community forum to draw additional attention to the mental health crisis in Nevada, and also to highlight some of the initiatives underway at UNLV by UNLV faculty to address these needs here. So this is the Lindsay Institute, UNLV Practice, Be Here in Nevada, and the Department of Psychology at UNLV. And if you want to look at the entire, it's up on our YouTube table. The entire event is on our YouTube channel there, so you can see that. But the presentations that are going to follow are going to highlight some of these initiatives. So I'm going to turn it over to Dr. Paul. Oh, you want the clip?
And thank you.
Good morning. I am Michelle Paul. I am the Executive Director of UNLV Practice and the Assistant Vice President of Mental and Behavioral Health at UNLV. It's good to see you, and thank you for letting us share with you some of the initiatives that we're engaging in at UNLV. So what is UNLV Practice? It is a partnership for research, assessment, counseling, therapy, and innovative clinical education. And what is that? In 2012, we opened our doors. We are a community mental health training clinic. We are uniquely collaborative in that we are a partnership between the College of Education, where they train school psychology graduate students, and the College of Liberal Arts, where they train clinical psychology. Also in the College of Education, we have mental health counseling students. So these are master's and doctoral students who are required to have supervised clinical practice before they can graduate. And so we are a community-facing mental health clinic where the students provide mental and behavioral health services under expert faculty license supervision. The services we've been providing since 2012 include individual psychotherapy, group psychotherapy, and telehealth services to the entire state through, well, not the entire state, but to northeastern rural counties of Elko and Humboldt through a community in schools partnership. Annually, we provide services to about 500 to 600 unique individuals and for youth, their families, and about 6,000 to 7,000 hours of low-cost sliding scale services. We are just now able to start billing Medicaid. We set ourselves in our first 10 years a goal to establish a location in the heart of Las Vegas, near UMC in the medical district, in order to increase access and accessibility of our services to the community. And we were able to establish a satellite donor-funded clinic. To have this additional infrastructure allowed us to compete for and achieve, get granted a combination of federal and state ARPA funds to develop several new programs. Specifically, these are services for the early identification and intervention for youth extending down to age 12 who show signs of severe mental illness, including bipolar illness or risk for psychotic disorders, as well as an expanded rural health outreach program. Interconnecting with our pre-existing Communities and Schools partnership, we're working to screen and identify those youth at risk, at highest risk for severe mental illness, and do that with a collaborative approach, now bringing in social work as well as psychiatry. So those highest risk youth get wraparound services through our practice clinic. With the support of President Whitfield, we embarked on a strategic plan to further innovate in the next 10 years. And we seek to be a uniquely interdisciplinary mental health institute. One of the challenges in mental health is mental health to the community, we're peppered all over the place. Folks don't necessarily understand the difference between a psychiatrist, a psychologist, a social worker, a counselor. And it's our responsibility to take that confusion away and to work together. So underneath an academic health initiative at UNLV, we have specific schools, School of Medicine, School of Dental Medicine, public health, integrated health sciences, and nursing. But mental health is peppered across 4 different colleges. So underneath UNLV practice, the president and the provost have asked me, as the assistant vice president, to coordinate all of the mental and behavioral health training programs at UNLV. And that includes all of the ones that I mentioned before: counseling, clinical psychology, school psychology, also now social work, and couple and family therapy. Those are the non-medical mental and behavioral health programs. We'll work collaboratively under this project mission to create a united voice for greatest impact in addressing Nevada's mental health crisis, alongside our other healthcare partners, for a uniquely integrated and interdisciplinary mental and behavioral health as well as physical health impact. And of course, working alongside our partners in psychiatry and psychiatric nurse practitioning as well. I want to mention that this is uniquely interdisciplinary. We asked our consulting group that helped us develop the strategic plan to do a nationwide search for model programs, and there wasn't one. So we feel like we are on the leading edge of training the mental and behavioral health high-level workforce to train alongside each other and minimize confusion for the community, but also maximize our collaborative effort alongside physical health. So our goals are to continue our work to continue our already work in mental and behavioral health services and become a center of excellence. We already do outcome tracking and do evidence-based care. Well, we want to expand that and make sure that not only are our students trained in mental and behavioral health evidence-based practices, but also we want to demonstrate our impact on our outcomes through excellence and deliver unmatched services. We're going to expand our research. As I mentioned earlier, that enhanced infrastructure allows us to do strong interdisciplinary research. These are complex psychosocial problems. We can no longer be siloed apart from each other in our various colleges and programs. We have to have a collaborative, collective infrastructure that allows for interdisciplinary training and research. We expect to expand our trainee workforce through our expanded infrastructure so that we will be able to provide as supervised clinical experience for as many of our graduate students as possible. We expect to be a center for policy advocacy and government relations. We'd like to be a go-to trusted resource for the community. When there's a mental health question, we want to be there. And lastly, you don't have an institute without a goal of financial sustainability. So we'll be working with our partners in the state, in the community, in philanthropy, and at the university to make sure that we can not only sustain what we've already built over the last 10 years, but grow and sustain beyond that. Thank you.
Good morning. My name is Sarah Hunt, and I'm the Executive Director of Be Here Nevada. And my presentation is going to be really focused on mental health workforce development. I'm not going to spend a lot of time on this slide, as my colleague already highlighted the shortages of school-based mental health professionals that we have in the state. So what we are trying to do through legislative action that you all took in the last session is to establish a designated behavioral health workforce development center. And that was done through Assembly Bill 37 in the last session. That was a bill brought forward by the Rural Regional Behavioral Health Policy Board. And the idea is to start investing in outreach and education about mental health careers, the options to work in mental health, what that looks like, and the education pathways by starting to do that outreach into the K through 12 system. Then invite those students, hopefully, to seek their education in our higher education system in Nevada, and then work on the retention side of things. So how do we get our graduates coming out of our higher ed institutions to want to seek licensure, employment in Nevada, and what do we need to do to support the already existing mental health workforce? So a little bit about what Assembly Bill 37 is asking us to do is to focus on kind of those three chunks of that pipeline recruitment. So as I mentioned, historically, mental and behavioral health professionals just have not shown up in the K through 12 space to talk about the options to work in our fields and what that looks like. So we want to invest in doing that across the state. Also, for the Rural Policy Board, it was important for them to offer the same outreach and education about careers to adult learners. So maybe those individuals that are working in entry-level healthcare positions are maybe looking for a career change. Those individuals with that lived experience, we would love to make sure they know about the options to work in mental and behavioral health and how to connect that to higher education. At the higher education level, there may be a need to expand some of our already existing training programs, so we could take larger cohorts, or maybe there are new degrees that we actually need to offer that would best fit the mental and behavioral health needs of our state. And again, that retention piece. So what do we need to do to strengthen that bridge from graduation to employment in Nevada in mental and behavioral health? One of the things that was important also to the Rural Policy Board was to offer some sort of business technical assistance program. So that would be for folks that may be coming in from out of state that are interested in setting up a new clinic in our communities, a place for them to go to identify what are all the licensing boards that we have for professionals, how do you get a business license, who are the insurers doing business in the state, that type of thing. So that will be coming in our initiatives. So what have we done to implement Assembly Bill 37? So after it was passed, one of the things that is in the bill is that this is an initiative under the Nevada System of Higher Education. So that meant that NSHE had to designate an administrative hub for this Behavioral Health Workforce Development Center. They did that in their September 2023 quarterly meeting and awarded UNLV the ability to establish the administrative hub for what we now know as Be Here Nevada, which stands for the Behavioral Health Education, Retention, and Expansion Network of Nevada. So once that happened, we kind of officially opened our doors on October 1st, and what we've been doing since then is a lot of hiring and onboarding personnel. As the executive director of Be Here Nevada, I simply cannot do all of this work by myself, so it's taken a while to get some support staff, and we're making good progress on that. We also wanted to make sure we got ourselves out in front of the public. So we've been working on our outreach and marketing, establishing our website that just launched within the past month, doing a lot of follow-up presentations to stakeholders. So you got this bill passed, what are you doing about it? So that's kind of what we've all spent some time doing. And with the idea of having this administrative hub at UNLV, the idea was to have a hub and spoke model of the Be Here work. So we've been building out those spokes now to the other NSHE institutions. And that, we've got some action shots. So how it's been going. Let's see, on my left, the far left picture there is myself and my staff. As part of those marketing materials, we got our first retractable banner and we were super excited that day. So in that picture is myself, our administrative assistant, Adriana Monroy, and our graduate assistant, Eternity Claggett. She's in our master's program at couple and family therapy at UNLV. The next picture then is our Associate Director for Education and Training, Jill Mannett, and this was at our very first career fair, high school career fair that we did at Fernley High School. So that was our first one at the end of March, and we have 3 or 4 more scheduled now in May and into June. That was a picture from our drive out to Winnemucca, where we wanted to visit with Great Basin College campus out there and introduce Be Here Nevada to their staff. But also in this listening tour with the NSHE institutions, we've learned a lot about the connections they already have to the K through 12 systems for building that pipeline. Over then on the far right, part of, again, the marketing and outreach, we have a few different social media platforms that we're using. That was a post we did in March to recognize Social Work Month, and we posted links to our different programs for social work training within NSHE. And then the bottom picture, again, was myself and Dr. Mannett out at Great Basin in Winnemucca. So what's next? We've got a lot of work to do. And so we're continuing through the meetings with our NSHE institutions. They've really provided a lot of warm handoffs to folks in the K through 12 systems that are local to them, that we're starting to introduce ourselves to the school counselors, be invited to more of those high school career fairs. We're collaborating across then with those NSHE mental health and behavioral health training programs to come in and provide some additional education about the career options, even in our higher ed systems. Data. So we're partnering with UNR Office of Statewide Initiatives and Dr. John Packham. You may be very familiar with the work that he does on the count of our healthcare workforce. So we're going to partner with him to be able to track the progress we're making in the number of mental health people in the workforce as we roll out our initiatives. We also want to explore grant opportunities. We're waiting to hopefully announce very soon a grant that we actually were able to get to hopefully provide some scholarship opportunities into our higher ed training programs. Our first legislative report to all of you is due in a couple months, so we will be working on that right now and putting that together. In the next fiscal year, what we really want to do is focus then on building the retention side of things too, so we have a new staff member hopefully coming on board very soon to work on that. So again, that piece of reaching out to our soon-to-be graduates in higher ed and connecting them to the opportunities to work in Nevada, building that technical assistance programming, and looking at additional grants that we can secure to support our work. And again, I mentioned we have a new website. It's being built out, so don't spend a lot of time on it. We're getting there. But I am told that if you take a picture of that QR code, you can then sign up for our monthly newsletter. We are also rolling that out so we can, again, keep those interested, our stakeholders, informed about how we're implementing Assembly Bill 37. And that is our cute little mascot, Winnie the elephant, and happy to answer any questions at the end. Thank you so much.
My name is Kelly Ann Beavers. I am a research associate at the Lindsay Institute. Thank you for the opportunity to share this information with you, and thank you for your leadership here in Nevada. So I'm here to share with you a specific initiative, a grant that the Lindsay Institute is partnering with the Department of Psychology at UNLV on. I'd like to tell you about the pilot program that we are beginning, and as well as the vision that we have for the future of this work. The first thing I want to do is emphasize that the relationship between chronic absenteeism and challenges with mental health is direct and overlapping. So the state of Nevada has over a third of Nevada students have been chronically absent in the 2022 to 2023 school year. This places Nevada with about 6 states that have that high of a severe rate of chronic absenteeism. Chronic absenteeism meaning over 10% of school is being missed. And for reference, before the pandemic, this rate was 18.8%. This rate is worse for underserved populations, as well as the experience of mental health challenges being more severe in underserved populations, including those who are having adverse experiences like racism and discrimination that have immediate and lasting effects, and students with disabilities who are the most high risk and often overlooked in being able to receive care for mental health conditions. So I'd like to talk to you about why our grant is working with youth in schools specifically, because there is a relationship between chronic absenteeism and problems functioning for students. We've listed some examples of those problems functioning that students experience, and it also is a barometer for mental health challenges further down the line. So we specifically are working with pre-K and kindergarten and first grade students during this pilot in hopes of being able to monitor the data as we go forward, and also in hopes of being able to intervene earlier in the children's experiences to prevent some of those indicators that can unfold later, like not finishing high school, potentially ending up in the criminal justice system. All this data is related. I'd like to emphasize a bit before I move into talking about our program that there is a contorted pathway of challenges from symptoms to actually getting services that the mental health professionals in the schools experience as well as families. So there are multiple moments in between noticing that a child has symptoms and actually finding services, at which the limitations in the system of mental health care in Nevada create challenges for even the most well-meaning of families and professionals who are trying to navigate the system. This pilot program that we're participating in, it is a school-based service delivery. So Dr. Kearney, who is the department head at the psychology department at UNLV, and his graduate students and myself will be working with school-based mental health care professionals to help them monitor chronic absenteeism on a weekly basis so that we can intervene earlier when we find that students are missing more than a quarter of school within 1 week. We'll reach out to the families, and that's the first level of intervention. So the multi-tiered systems of support is a framework that isn't exclusive to our grant, but it is one that we are embracing, and one of the things that we'll be helping with is this screening of absenteeism and mental health challenges that are related to it. We have 2 schools that we are going to begin our pilot program in. One is a preschool, The Hills. We were able to make this relationship through United Way and the Nevada Ready program. We're hopeful that this program could expand throughout the Nevada Ready pre-K program. United Way is interested in seeing how this pilot unfolds and the potential for that. And then we're also working at a charter school, Battleborn Academy, in downtown Las Vegas and East Las Vegas. Both of these schools have populations of children that are experiencing housing instability and a range of other challenges that make this a very meaningful place to pursue this work. This slide just gives an image that can give you a sense of what the tiered systems of support are. As I mentioned, the first level will be screening chronic absences. The second level allows us to facilitate conversations with families under the advisement of the mental health care professionals at the schools. So we are working very much in tandem with what they feel is best for the students, but helping boost their capacity, which we all know is limited. And then the third level allows us to support them in making referrals for outside assistance when needed for the most severe cases. I'd like to lastly add that a part of this grant is us creating a community asset map that will be initially intended to support the mental health care professionals in the schools. So it will be completed for the first phase in June. It will have a list of providers that serve children all throughout Nevada. It will be complete with, do they have a waiting list? Do they accept insurance? If not, why not? Do they work with children? Do they have a specialty? There's a range of data that has been collected by the graduate students that are working with Dr. Carney. So that asset map is something that we're hoping to, as part of this grant, get online as a web resource for school-based mental health care professionals. This is something that sadly they do not currently have. So when they're making referrals, they don't have a clear system of information to consult about where to recommend a child. As far as a future vision for this asset map, I just want to note that I've been a part of the Children's Mental Health Coalition locally that has started convening since late last year, and there has been expressed interest in something like this database that we're creating being available beyond just the school system, and including things beyond just mental health care providers formally, and including preventative services, things like 4-H, community gardens, ways in which children's mental health can be supported. So that's something we're also building out for the schools and hope to build out further in the future if we can have funding to continue to do that. Thank you.
Well, again, thank you for having us, David Demore, for the record here. So you get a sense, continued implementation, working with community partners, but I do want to highlight a key point here. All of these initiatives that we brought to you today are funded either through grants, philanthropy, or one-shot legislative funding. So the sustaining and growing these programs are going to take long-term funding solutions that we bring to you for your assistance in promoting that in the legislature. Thank you.
Thank you very much for being here. And if you just sit close, I think no, you can go back to your seats, but stay close because at the end, we have a couple more presentations. I believe there might be some questions for you. So thank you. Next, we have Dr. Kristen Clements-Knoll with the Schools of Public Health at the University of Nevada, Reno. You are in Carson City, I believe. Begin when you're ready.
Kristen Clements-Knoll for the record. Thank you, committee members, for inviting me today to speak about the Youth Risk Behavior Survey. Good. Yeah. So I'm going to present just a little bit of information from our middle school and our high school Youth Risk Behavior Survey. In particular, I've been asked to speak on some of the mental health outcomes, but I can later on also answer questions about substance use and other behavioral health issues. So I want to acknowledge our partners with the Youth Risk Behavior Survey, Nevada Department of Education, the Nevada Division of Public and Behavioral Health, the Nevada Statewide Coalition Partnership, school district superintendents and their staff, and absolutely the school administrators and the teachers who really do a lot of the hard work and are great partners on this project. So just to give you a little bit of a overview of the way the Youth Risk Behavior Survey works in Nevada, which is quite different than other states. The CDC has been funding Nevada to conduct a statewide YRBS survey since the mid-1990s. And that is approximately 36 high schools statewide. And so, as you can imagine, the majority of those schools are in Clark County. We usually only have a couple schools that would be randomly selected from our rural counties and maybe 3 schools in Washoe County. So for many years, even before SB 69 was passed, the Nevada Division of Public and Behavioral Health has been contracting with UNR to sample all of our regular public, charter, and alternative high schools and middle schools in the state. We also sample our tribal schools. So this is approximately 220 high schools and middle schools compared to the CDC funding, which is only covering 36 high schools statewide. SB 69 required that all secondary schools participate in a YRBS. However, this is an unfunded mandate. And so we've been lucky enough to be able to secure supplemental funding to the CDC funding with the 36 schools to date. So the way this works is all schools are asked to participate, so all districts have to participate, but certainly a school could decline. And classrooms are randomly sampled in each school. And then within the classroom, following parental permission, the students will complete an anonymous survey at the classroom level. And the teachers of those classrooms receive an incentive, which they use sometimes for classroom supplies. Sometimes teachers have told us they had a pizza party. They can use that incentive for different things. And there's an additional incentive if they're achieving a high response rate. So today I'm going to show you data from 2019, which was data that were collected before the COVID-19 lockdowns. 2021, which would be data that was collected once students had returned to school, and then our most recent data collection, 2023. So you can see that our response rates, which this is a combined response rate of schools and students, at the high school level has been pretty stable. So you usually have about 5,000 students in the sample, and our response rates are, close to, I guess we're up to 69% now. In 2021, we had the second highest response rate in the nation. And our middle school response rates are a little higher, especially in more recent years. We've had an increasing number of middle schools more recently. So you see that our sample increased from about 5,000 to closer to 7,000, and we have an increased number of schools. Every year, only a couple high schools and middle schools do not participate, and this was the case even before the Senate bill had passed. So one thing to know about the timing of the YRBS is usually we collect data in the spring semester, but due to the COVID-19 lockdowns, and I'll go back to the response rate just real quick here. In 2021, we had to collect data in the fall. Therefore, students were a different age. And so we always weight our data based on sex, race, ethnicity, and grade, and we also weight the data based on the region in which people were sampled. But because we want to be able to compare across time, we also further weighted our data by age, which is not something that CDC would do. So if you see CDC estimates, for that year, they may be a little different because students on average were a different age than they normally would be. So when we do this, what we're trying to ensure is that our results represent all middle and high school students in Nevada. So we use the local school district demographic data to weight the data so that we can account for students who maybe weren't present or did not participate. CDC has not released the 2023 data. However, because we do the data in-house, that's what we're sharing with you today. I do not expect the mental health data to change, but that's just a note. So first I'm going to talk about the high school trends. So again, this is student self-report data. These are not diagnoses, and this is an anonymous survey. So there's several mental health indicators that focus on the past 12 months. And you can see that from 2019 to 2021, there was actually a significant increase in the proportion of high school students who self-reported depressive symptoms in the past 12 months. And this is a standardized measure of a certain way of feeling for 2 weeks or more at a time. And that reduced, it went down in 2023, but that decline was not significant. So it did not go back to the pre-pandemic level with the high school students. Similarly, there was an increase in non-suicidal self-injury, and that increase from 2019 to 2021 was a significant increase. And again, that did not go back to the pre-pandemic levels in the high school sample. If you look at some of our suicidal behavior variables in the past 12 months, you see that there was an increase in suicide ideation from 18% to 22% from 2019 to 2021. Again, that did not go down to the pre-pandemic level, so significant increase, but then there was not a significant decrease. We see the same pattern with making a suicide plan, and in 2019, 9.1% of the high school students had made at least one suicide attempt in the past 12 months. That went up to 12.3%, which was a significant increase, and again, that did not decrease. We also saw an increase in electronic bullying from 11% in 2019 to 14.8% in 2021, and that remains stable at about 14% in 2023. We do ask questions about bullying on campus and in-person bullying, but because students weren't in school for 12 months, the past 12 months in 2023, that question was not on that survey, so it's not comparable across years. There is also a question we asked. Many of these are state-added questions. You're not going to see these on the National Youth Risk Behavior Survey. And this is really among youth who were feeling really more, I guess, symptoms of anxiety, depression. Were they able to get the help they needed? So this is their perspective. It doesn't mean they didn't access services, but this is their perspective. And this is a proportion who said they rarely or never received the help that they needed. And you see that there was a higher proportion of youth in 2021 who were not receiving or did not feel they were receiving the help they needed. But that did go down to pretty much the pre-pandemic level, but it's still very high. So now I'm going to give you a little information on the middle school trends. So our middle school data actually has been very consistent in these mental health outcomes. We did not see that increase in any of the mental health outcomes except one, which I'll get to in a moment, with the COVID-19 lockdowns. So you see that depressive symptoms has been very stable at about a third. Non-suicidal self-injury, while high, has been stable. We see the same trends. The only increase was in suicide planning, but very stable trends in suicide ideation and suicide attempt in the past 12 months. Most states do not release middle school data. Nevada is one of the few states that does a middle school survey. However, the few states that do have a middle school sample have seen the same trends where mental health indicators got worse with the pandemic with the high school youth, but they actually remain stable with the middle school youth. This may be due to a developmental issue where middle school youth are a little bit more still connected to their families, and the stay-at-home orders may not have had as big of an impact. But this is something we've seen in other states that do a middle school YRBS as well. However, we did see a significant increase, as we did in the high school data, with electronic bullying, and that remained high in 2023 as well. And there was no real change across time, but close to half of the youth, middle school youth, who were reporting some kind of a mental health issue I forgot what it was, maybe last month or so, said they never or rarely received the kind of help they needed. So I'm going to talk a little bit about a couple subpopulations where we have higher rates of mental health issues. So I'll be showing data with our high school sample and our middle school sample. We have two questions that focus on sexual identity and gender identity. We are required to ask these questions due to receiving state funding. And you can see that about 27% and 26% of youth self-report being lesbian, gay, bisexual, transgender questioning, or sometimes it's another category. And this is similar to what we see in other states as well. Majority of this proportion is sexual identity, not gender identity, but we do have about 7% of youth who are reporting that they are transgender or gender variant. There's pretty striking differences in all the mental health outcomes being much higher among sexual and gender minority youth. So with depressive symptoms, 63% of LGBTQ plus youth reported depressive symptoms in the past 12 months compared to 35.6% of youth who were not sexual or gender minority. And we see the same pattern in our middle school sample. We also see elevated rates of non-suicidal self-injury in both the middle school and the high school samples. And similarly, our suicide variables are much higher in the sexual and gender minority youth compared to the non-LGBTQ youth. Same pattern with making a suicide plan, and the same pattern with a suicide attempt, and all of these are highly significant results. We do not see differences in self-report of getting the kind of help you need by sexual and gender minority youth compared to other youth. And that would be true in the high school sample, middle school sample. We have a little bit higher, but that result was not statistically significant. We also asked some questions on adverse childhood experiences. I'm only going to show some of those indicators, and I'll talk about the additional indicators we also include. So this is looking at lifetime exposure to adverse childhood experiences, and you see that the highest proportion of youth are reporting emotional abuse. We have about a third reporting physical abuse, 10% sexual abuse, 12.6% physical neglect, and then if we keep going down to some of the areas of household issues, 25% parental substance use, and then about 16% had an incarcerated family member living in the home. The middle school sample has one fewer question. We are moving to the same questions being asked in both middle school and high school samples in the future. It's the same pattern of prevalence in the middle school sample. Some additional adverse childhood experiences we measure include housing insecurity, food insecurity. We looked at bullying earlier. We also look at other forms of sexual violence within a dating relationship, for example. So if you look at the overall ACE score, you see that about 22.7% and 26.7% of youth did not report any of those what we would call standard ACE measures. But if you look at these higher level categories, for example, the 4 or more ACE category, we have 21% of high school youth reporting 4 or more ACEs, 14.3% of middle school youth. Part of the difference between the two groups is because, remember, middle school youth have one fewer indicator, so that makes a difference on the ACE score. So what's important with the mental health indicators is this very strong, what we would call sort of a graded relationship between adverse childhood experiences and experiencing a mental health outcome. And it's quite similar for both the relationship with both our high school and our middle school sample. So you see that among youth who report 0 ACEs, only about 3% to 4% of youth had thought about suicide in the last 12 months, but that increases to close to half if we get to the 4 or more ACE category. And the same pattern is true for our suicide attempt data. I could show you every mental health indicator and every substance use indicator, and you're going to see the same graded relationship, unfortunately. We also are measuring adversity that goes beyond sort of the individual level. So we are linking data on child poverty, on adversity within the community, violence within the community, so that we have some other indicators of adversity as well. So Youth Risk Behavior Survey is focused on risk, but we have embedded several measures of resiliency or positive experiences, youth experiences, and we are going to be adding more domains in our next survey administration. But here you see the high school and middle school sample that are self-reporting some positive experiences around communication with their family members, and some positive experiences around school connectedness, feeling like they belong at school and having a good relationship with teachers. When we look at these measures, we find that the same dose-response relationship we saw with adverse childhood experiences, we see in the opposite direction. So the more resiliency and positive childhood experiences a youth has, the lower the prevalence of those mental health outcomes. And we also have found that, particularly in the middle school sample, that we are able to sort of buffer some of those negative experiences. So youth who have higher resiliency tend to have, for example, if they had a high level of electronic bullying or maybe an ACE measure, this resiliency can buffer or sort of bring down that negative mental health outcome. So the positive experiences are important, and they seem to be a little bit stronger in terms of their connection to mental health outcomes in the middle school sample. So this is a link to all of our reports and information. We are currently working on getting out the 2023 data, but you will be able to look at regional differences and racial ethnic differences and other things like that. And I can also send more information on other behavioral health outcomes if that's of interest to the committee. Thank you for your time.
Thank you very much, Dr. Clements Nolan. Please do send that if you just want to send it to my email or committee staff, and we'll make sure to get that information out. Thank you for the presentation. Next, we will have Christy McGill with the Nevada Department of Education and Melinda Southard with the Department of Health and Human Services in Carson City. Please go ahead when ready.
Christy McGill, Deputy Superintendent of Educator Effectiveness and Family Engagement from the Nevada Department of Education. And I'm here today with my partner, Melinda Southard, who is the Deputy Administrator from Nevada Medicaid. Are you guys seeing my slides? Oh, there we go, great. Just want to quickly go through a quick clarification. We'll be using the terms behavioral health, which is inclusive of the whole continuum of the child and includes mental health, social emotional, all that good stuff. So you heard a lot already about the why, so I'm not going to go through this, but the one thing I really want you to remember is one thing, and that is that our students now are living with chronic illness more than any other student in the past. So whether it is mental health, physical health, developmental, autism, through diabetes, through asthma. Because of this, and because our schools are blessed to serve all kids, those needs must really be met, and why my partner here from Medicaid will be presenting alongside of me of what some of those strategies might look like. Also, I want you to see that some of the strategies that the CDC recommends is already going on in many of our schools. So if you go into our schools, sometimes you'll see things that promote mindfulness, social emotional learning. We have standards aligned with the academic standards in most of our schools now. So this shift to really looking at, yes, we are a digital world, but our schools are amazing places to teach that social and emotional bonding between humans. And so that has really rose to the surface with this generation. And so anything from that tier 1, that social emotional learning, to tier 2, the interventions, the group work, and then also tier 3, many of our schools are doing comprehensive mental health services right there in the schools to make sure that they have what they need to continue on with their education. I know that you guys have heard me talk a lot about multi-tiered systems of support. We have a strong relationship with the University of Nevada, Reno, who has been working on this project for about 8 years. Currently, we have 10 districts that are implementing multi-tiered systems of support with Fidelity in 149 schools, accessing 99,419 students, and then just this year alone, 41 trainings. Also know that there are district leadership teams that meet each month that look at how do we implement multi-tier systems of support. And the reason why many of the districts and Department of Education and many of the partners that you heard today look at multi-tiered systems of support is because it gives us a framework to look at the data and to really so that schools and districts can tailor the intervention to the needs of that student population. It's not a one-size-fits-all. As a result, implementing multi-tiered systems of support is not for it takes time. It takes 1 to 3 years to really stand it up properly. Also, this is some free trainings. If you guys ever want to go in or have people question multi-tier systems of support, is a little abstract, and so here's some really quick trainings to kind of take a look and be able to look at the system itself. Again, the 4 main strategies of this system to look at the whole child is that universal screening, that progress monitoring. It's not enough just to start an intervention. We really need to make sure the systems are in place to progress monitor that intervention to ensure that indeed the schools are making that positive student outcome that they really are trying to do. Also looking at tiered interventions, increasing with intensity. I think this is so important because when schools do that tier 1, and schools are, this is their job, right? Tier 1 instruction, both math, reading, but also social emotional. And when that is done well, we actually see a decrease in needs for tier 2 and tier 3. So why that tier 1 and why that prevention is so important. So just some of the outcomes, just very quickly. When we see schools implementing multi-tiered systems of support, the behavior side of it, we see decrease in problem behaviors, we see decrease in dropout rates, and we see gains in the school climate survey. So it kind of cools the climate, everyone knows the expectations, and we start to catch kids before they fall. One of the things that you may hear about is one system, multiple practices. So I know that there's so much pressure put on schools and there's so much stuff out there that they have to do. With a multi-tiered system of support, it really looks at what is working, what's not working. We can get rid of those things. And if we need to bring in new interventions to meet needs, both on the academic side and on the behavior side. The process is the same. And so it's symmetry, so both academics and on the behavior or on the mental health. We have a couple of projects we wanted to highlight around what does school-based mental health look like. So one of those projects is our Project Aware grant. This is the second time that the Department of Education has written on behalf of a few districts. The districts that are piloting and working through school-based mental health right now is Washoe, Carson City, and the Charter Authority. As you can see, they have Tier 1 goals all the way up to Tier 3, and then of course the system goal with multi-tiered systems of support. As you can see, an increase of awareness of mental health issues among school-aged youth is one of the priorities. Also making sure that youth get to services earlier so it doesn't, especially in those early years as well. Just a quick little snapshot, you can see the numbers of students that have had interventions, that have had screenings. You can see up through the supports what have occurred in these two projects, and if you guys have questions, you're more than welcome to ask us or the districts themselves. The second project I wanted to bring to your attention is the Trauma Services Demonstration Grant. This one is a unique grant that Nevada has done really well with. Nevada has created a network of community-based service providers so that if a child has experienced trauma and they do not have the ability to pay for services, this grant will pay the provider to see those students. So, for example, if a young person has had an adult or has their primary caregiver pass away, and perhaps they are on a limited insurance model that does not include mental health, this grant can include those services. Also, this grant we work with 35 different mental health agencies and over 300 providers. One of the things we really wanted to make sure and what we learned is that when it comes to trauma services, choice for the family and students is really important. So having a diverse amount of providers and being able to meet the needs of those specific, even in our rurals, sometimes our rural people do not want to go to the mental health provider that's on the corner, and so telehealth has also been an important component of this project as well. 1,200 students have accessed this, and over 23,000 hours of therapy has occurred to help students recover from trauma. Oops. I want to leave you before I turn it over to my partner Melinda with just a few recommendations. One is that whole child approach. I think you heard that from multiple people today through that multi-tiered systems of support to make sure that the interventions match the needs of the students. Prevention, of course, very important, that social emotional learning. Again, doing that well reduces the amount of need for Tier 2 and Tier 3 services. And then also really making sure that we erase the barrier between school-based services and community health services. It's an and. Our students need both. School is a place they are learning to live and grow up, and so these services need to be in schools as well as in the communities, and there needs to be communication between the two. And so I know a lot of people say, well, let's focus on community services, and then there won't be the need for school services. And I think we can reduce the need at schools, but I think we will still have the need to have Tier 2 and Tier 3 services actually being implemented in our schools. So let's make sure that our schools have the necessary resources and funds they need to do this well. And with that note, I'm going to turn it over to my partner because she has some strategies to help bring schools and districts those resources. Yes. Thank you. Oh, it's not working. Oh, here. I'll go to this one. Okay.
Good morning, Madam Chair and members of the committee. My name is Melinda Southard, and I'm one of the Deputy Administrators at the Division of Healthcare Financing and Policy, otherwise known as Nevada Medicaid, and I just really appreciate the opportunity to present alongside our partners at NDE today. So here on this slide, I wanted to highlight that we have received national guidance from our partners at the Centers for Medicare and Medicaid Services, or CMS, in consultation with the U.S. Department of Education in encouraging states to increase crucial healthcare access to children. Keep in mind during policy development that healthcare services delivered in schools are an excellent opportunity to meet kids where they are and provide this much needed support. Note that the term school health services can include all services covered under our early and periodic screening, diagnostic, and treatment, or EPSDT, otherwise known as the Healthy Kids Program in Nevada Medicaid. The EPSDT program includes a comprehensive array of preventative, diagnostic, and treatment services for people under 21 enrolled in Medicaid. This national guidance further notes that schools can be a place to help enhance early identification of health needs and connect students to a broad range of healthcare services, including mental health and substance use disorder services and other community-based services. Now I'd like to transition over to providing the committee with an update on progress made through Nevada Medicaid as it relates to school health services. If you could go back that one. Oh, yeah, sorry. So beginning in 2019, the division submitted to CMS and received approval to expand coverage of all school health services to all eligible students. This meant that Nevada Medicaid is now authorized to pay for all eligible services to Medicaid-eligible students beyond those required in an Individualized Education Plan, or IEP. So far, about half of our school districts actively bill Medicaid for school health services. Next, I would like to highlight that currently, in counties where the school district bills Medicaid for services, the county is responsible to pay the state share of costs for these services, while the federal government picks up the rest of those costs. These counties pay the state for Medicaid-covered services billed by public schools through an intergovernmental transfer, or IGT, via a contractual arrangement with Nevada Medicaid. In a recent announcement made to the district superintendents to help improve access to school-based health services for students statewide, all Medicaid-covered school-based health services will now be covered by Nevada Medicaid at no cost to localities as of July 1st, 2024. So this really aligns with the division's goal of promoting greater access to school health services. Third on this list, we would like to highlight that Nevada Medicaid covers a broad set of behavioral health screenings, assessments, treatments, and services for children in schools. Nevada Medicaid is also involved with our partners here at NDE in a multi-agency state team conducting a school survey and in-person statewide listening tour with each school district this spring. I wanted to highlight this because in that same vein of improving access to healthcare services, the division is highly interested in improving the relationships with the school districts and our other state agency partners to the best possible level. One of my roles at the division is to really elevate school health services to a platform where we can actively collaborate together on improving our Medicaid policies and removing barriers and challenges faced by schools when billing or looking to bill Medicaid for services. One of the first steps in this improvement is meeting face-to-face and having the opportunity to sit, talk, and listen with the schools themselves. We've already started on these visits, and I'm grateful to say that we've already learned so much from the schools we've met thus far. I'm truly excited about the upcoming changes to really streamline the school health services program in Nevada, a direct result from these very conversations. As you may have picked up already, one of the primary goals of the division when it comes to school health services is to clearly understand the unique billing barriers facing each school district so that all state partners have the resources and the ability to provide a more tailored approach of that targeted technical assistance to each individual school district. Lastly, I wanted to note here that the division has applied on behalf of Nevada to CMS for a grant opportunity for the implementation, enhancement, and expansion of school health services. And a primary focus of the proposed budget that we put forward is to submit or to support a billing and electronic health records, or EHR, vendor available to school districts. The hope is to remove the financial barrier for schools already or interested in billing Medicaid to first acquiring that billing vendor and EHR system to do so. Again, we are extremely thankful for the positive relationship and collaboration felt between Nevada Medicaid and our variety of state and local school partners, and we are excited at completing these revisions to the School Health Services Program to continue to remove barriers and make it much simpler and less time-consuming for schools to bill Nevada Medicaid and receive reimbursement for services they are already providing. With that, thank you for your time today.
Christy McGill from the Nevada Department of Education. I just want to leave you with one last resource on this topic, and that is our students. If you guys have not met this generation of students, you should. They are amazing, and they will crash through all of mental health stigma for us. And so please, when you are considering, make sure you bring them in. I concur with NAMI, our partners over here, that those peer-to-peer strategies and the students themselves are really good about talking about mental health, much better than we are. So please utilize them as a resource and bring them into those leadership decisions as well.
I wasn't sure if you guys were done or not. I knew there was a couple more slides, but I'm not seeing you yet. Let me go back to Carson City on the screen. Oh, all right, perfect. Thank you. Thank you for being here. Unfortunately, we will not be hearing from the National Association of Social Workers, so that was kind of a bummer, but maybe we can get them at some point. So we will move on to Cassie Griffith with the Nevada School of Counselors. Oh, no, I apologize. We will go to Jessica Sheeran, the president of Nevada Association of School Psychologists. And you are here in Vegas. Great. Thank you. Begin when ready.
Thank you. I'm Jessica Sheeran. I'm the president of the Nevada Association of School Psychologists. I'm here today to talk to you a little bit about who school psychologists are, what we do, and what we can bring to Nevada, what we do bring to Nevada currently. So, who we are. We are highly trained professionals in the schools. I often say that school psychologists are some of the psychologists who are most educated in education and educators who are the most educated in psychology. We are trained under 10 different domains: database decision-making, consultation and collaboration, academic interventions and supports, mental health and behavioral health services and interventions, school-wide and systems-level practices to promote learning, services to promote safe and supportive schools, family, school, and community collaboration, equitable practices for diverse learners, research and evidence-based practice, and legal and ethical practices. There's some bullet points on the presentation as well as some more ways that we support in those areas. However, I do want to highlight that the majority of school psychologists' time is spent completing psychoeducational evaluation for special education services. I would say conservatively about 80 to 85% of our time is spent doing that. And because we are completing assessments, writing reports, contacting parents, contacting educators, we're not spending our time doing the things we are most trained to do, which is mental health supports. And as we've talked about so far, from the other presentations, this is a high need in Nevada. We need school mental health professionals providing the services to students that they need. Not to discount the work that I do every day, completing the evaluations, that is also highly important, but we need to be able to find a balance to provide all levels of services that we are trained to do. So, why do children need school psychologists? Like I mentioned, all kids can face challenges. They can have needs for short-term and long-term mental health support, and when there is not someone available to provide that support, that leaves needs unmet. So we are here to support all other school mental health professionals, the counselors and the social workers, the nurses, the teachers, the admin, the parents, everyone involved in a student's life. We are one member of that team. So we provide a lot of really valuable resources for students. Where are we now? So between 2016 and 2020, the number of children and youth ages 3 to 17 diagnosed with anxiety grew by 29%, and those with depression grew by 27%. Of those, 80% did not receive any treatment. And of the youth who did receive treatment, 80% received it at school. So just to put that in terms of a classroom, if you have a classroom of 30, 6 of those kids are going to have a mental health need. And of those, 4 to 5 will not receive treatment or any type of support. And it's hard to break down 1 to 2 students in 80%, but in a school, there are just a handful who are getting the supports that they need. There's been a major increase in the behavioral needs of our students, and we don't have enough supports to give them what they need. In 2022, the ratio of school psychologists to students, as others have mentioned so far, was 1 to about 1,900, and our recommended ratio is 1 to 500. The 1 to 500 doesn't mean our job would be super easy, but it does mean that we would be able to provide the full spectrum of services that we are trained to provide. And with limited funding and limited access to those services, it makes our job really hard. And it's not just us, as others have mentioned in other presentations. School counselors are also almost double above their ratio, and school social workers are so far above their recommended ratios. So that just means that students' needs are not being met. So, ways to support mental health. So we need to sustain investments in comprehensive school mental health and behavioral health delivery systems that encompass mental wellness promotion, early identification and early intervention, and a continuum of increasingly intensive interventions. So someone else mentioned multi-tiered systems of support. We need solid tier 1 supports for behavior. We need a continuum of solid tier 2 interventions for behavior. We need solid tier 3 supports. We need access and connection to community-based supports. It doesn't just have to be within school, but the schools need to be able to connect to the resources that students need. Early identification of concerns and access to supports is critical. We need to reduce the ratio of school mental health professionals to students, and we do that through pathways. So I know some pathways exist to get access to higher education, to get into the field of school mental health, either through counseling, social worker, psychology within schools, but we need to continue those efforts. We need to fund those pathways, and we need to increase the awareness to those pathways. We really need universal screening and early intervention for students identified as being at risk for having mental health issues. So making sure that we are identifying as early as we can if there are risk factors present. We need to develop community and school partnerships based on collaboration between school psychologists and other school-employed mental health professionals and community agencies and providers. Requiring professional development for all staff for identifying those early warning signs of mental health concerns. I know that we can't put all of the needs of students on the backs of teachers. Teachers are so overworked and overwhelmed, but we need that everyone in the school building, from the front office staff, teachers, support professionals, custodians, to be able to identify those early warning signs, because anyone who has a relationship with a child in a school can make a difference. And identifying when someone is at need and being able to see that child is the most important thing that anyone can do when it comes to school mental health. We need to effectively utilize school psychologists in the school setting to be able to provide those mental and behavioral supports that we are trained to do. I currently am in Clark County, and I am at 3 schools. My ratio is close to 2,000, and I have not been able to make the connections to the students that I serve that I would love to be able to make. I am in survival mode of just surviving day by day, and I know I'm not alone in that. So being able to reduce those ratios, reduce our caseloads, and get us to do the work that we are so capable and trained to do is very, very important. It's also very important that we create trauma-sensitive school environments that fit within a multi-tiered system of supports. So that framework of providing a tiered level of support and accessing supports to all students, being able to access supports is critical, but we also need to have a trauma-informed and focused lens, because just about everyone at some point in their life will experience some kind of trauma. We don't ever know when someone's going to experience trauma or when they have experienced trauma. So making sure that everyone is fully aware and trained on trauma-sensitive practices is very critical as well, and it helps build those relationships, which are very important. And then the final thing I'll talk about here is, the next thing I'll talk about is why we need more school psychologists. So we need a comprehensive approach to reach the recommended ratio. So not only filling existing available positions, but also increasing the number of full-time positions that are available. Coordinating with our local universities to offer high-quality practicum and internship sites. I know that Clark County School District says that UNLV is one of our biggest recruitment tools because so many of those students come into our district, but we need to retain them. We need to make sure they stay. And we need to continue those partnerships with other local universities. Finding ways to reallocate existing school psychologist time, so reducing paperwork, having someone to help make phone calls, like the little things that take up so much of our time, finding ways to reallocate that time will help us to provide the services that are so important. And ensuring that there is a competitive salary and benefit package to recruit and retain highly qualified school psychologists. That's the biggest thing that's going to keep school psychs around. And then another thing that is new within school psychology, and something that our national association has been in the early stages of, is called the Interstate Compact for School Psychologists. This would establish an additional licensing pathway that creates reciprocity amongst participating states. So for example, if both California and Nevada were to participate in this, it would be very easy to have someone move from California to Nevada to practice as a school psychologist without having to face the barrier of licensure. So that's something that I wanted to plug. The Nevada Association of School Psychologists will be sending representatives this summer to our legislative summit in DC to get more information about this, to sign our organization on, and say that we are willing to do our part with our legislation to work cooperatively to push this compact, because I know that licensure can be a very big barrier. And if we eliminate that barrier, that's one less thing to worry about when it comes to bringing school psychologists here to Nevada. Thank you so much for your time.
Thank you very much. And finally, we have Cassie Griffin with the Nevada School of Counselors Association. And then after that, we will open it up to members for questions. Please go ahead when you are ready.
Good morning. My name is Cassie Griffith, and I am a member of the Nevada School Counselor Association Executive Board. I've also been a school counselor here in Clark County School District for 18 years. So today we're going to be talking about the need for school counselors as well as those school-based mental health professionals, what our students' needs, those mental health concerns that they face, and our current programming, what's in place in Nevada currently. So briefly, Nevada School Counseling Association is about 900 members strong. We provide professional development for school counselors to build capacity so that way they can have resources and ideas to be able to help our students and serve them as much as possible. We also advocate for the rights of school counselors across Nevada and the U.S. So I know we've talked a lot today about that mental health disorders in students. So just to point out what hasn't already been said, we've talked about there are several students in Nevada that are diagnosed with a mental health need. And we know that Nevada is ranked 51st out of the nation in mental health access and those resources for our students. But what we haven't talked about is that when the students can't get to those mental health resources, they're turning to our school-based mental health professionals. We become that primary mental health provider, and with our ratios that have been talked about, that becomes difficult. Earlier, it was discussed about the Nevada school and suicide deaths. When we look at those rates up to age 17, we can see that it has been consistently above 15 completed suicides since 2015. Some years reach far above that, so that is a very big concern. In our schools, our school-based mental health professionals are charged with reaching out with students when we see that need or if that's being presented to us. We are the ones that are helping to assess that risk and linking them to those essential and very vital community resources. Our service-based, school-based mental health service provider numbers, we've talked about the shortage. We know that there is a nationally accepted best ratio. School counselors specifically have a 1 to 250. We're about staffed, about 50% less than that. Most of our ratios are about 1 to 463. However, there are schools that have no counselors at all, and some that see a much larger caseload. We are ranked 10th worst among all other states for the least school counselors per students. We also have about 1,200 or less school counselors for over 482,000 students. Counselors that are based in schools, we focus on individual and group sessions to build skills to overcome social and behavior challenges and improve academic performance. About 80% of our time is spent either between indirect or direct services, providing them to those students. So those higher caseloads really make it difficult sometimes to get to all the students who are in need. There are statutes that are in place that do help provide a mandatory school counselor. However, there is a clause talking about shall the money be available. So it makes it difficult because there are those schools without a school counselor where maybe their budget doesn't allow for that school counselor, and those students are lacking that professional. There are several issues that our students here in Nevada face. Some of those are, anxiety and stress, the suicide risk, what we just talked about, homelessness, bullying, chronic absenteeism, and the barriers that get into the way of them attending school, trauma and the access to services. So in Clark County School District, we have what's called the Panorama Education Survey. And it's designed to really capture a student voice. It lets schools know what's going on with our students, whether it's the school climate, the culture of their classroom, maybe something at home, their friendships. We at the schools use the data to be proactive in supporting those students and their well-being, and then address their social emotional needs. So looking at these results, we can see that in secondary, there's an increase of the raise your hand category. And what that is that students are wanting to talk to an adult at their school privately about a challenge that they're experiencing. And I think that speaks highly to the need for that school-based mental health professional, because most of those challenges are things that they don't want to talk about in front of a large group. We know that we still have some work to do. We have some supportive relationships that's on the growth in our elementary schools, so that's another highlight. But we do need some areas of growth like belonging, a sense of belonging in our secondary schools, and emotional regulation in our elementary schools. And again, that's where our school-based mental health professionals really come in, because that's what we focus on and help them navigate through those concerns. So since COVID, we have a lot of technology in our schools, and there are some really great effects of that technology. However, there are some concerns that are on the rise. We know that students will use it for research. They'll connect with social media. However, sometimes social media comes with the unfortunate adverse reaction of, am I good enough? Do I have enough likes? I don't look like that person on social media. This person made this comment, or they didn't like it at all. There's also mental health support out there that will be used as an avenue through that social media. So there are good benefits. However, the more that they use this technology, sometimes that increases the addiction, which then we have to work through that as well at schools. The current support that exists in Nevada, so we have tons of support in Nevada. Nevada is doing a great job. However, there is always room for more. So we know that there have been several entities that have talked today, and some of them that are not here that school counselors use is the Youth Move Nevada, Nevada PEP, the Mobile Crisis Response Team, the Crisis Hotlines, 988, the Safe Voice, NAMI, and 211. One that's not listed is CCSD. They have provided support with initiatives that have allowed school counselors to use things like Hazel Health, Panorama Education, and helped us connect with different community resources. They've also helped teachers implement new health standards that connect social emotional learning and mental well-being into our classrooms. So it's helping support what school counselors do. Specifically, I can talk to at the elementary level when I can teach a lesson about social emotional learning. A teacher can then use that same idea to back it up with their health standard. So we're coming together to collaborate to become a very aware culture. There are community groups that are meeting to improve mental health. As I stated, CCSD has been working. They have been partnering with community providers to create resources for students and families, making it accessible and making it easier for us to use some of these initiatives that they've implemented in our classrooms. That includes like Care Solace, Rethink Ed, Panorama, the Harbor, Hazel Health, and they've also secured grants to help increase mental health programs and staffing. UNLV is also not listed on this slide, and they have been a great resource for us, whether it's a referral source and or just advocacy for school-based mental health providers. So what do our students need? Well, they need more school counselors. They need more school social workers and psychologists. We've talked about the ratios that are affecting the access to those healthcare providers in school. We've talked about we are becoming the primary mental health providers. It is hard. I can speak to my own experience. When I make a referral, sometimes it takes months and months. And so the interim between the school connection into the community resource, we are that person. Sometimes the barriers include access to services, transportation. Telehealth has helped. If you can make that referral to Hazel Health or other community entities that offer that community telehealth, it's been working well. But transportation assistance is also something that is a barrier. Sometimes the parent or the family is willing to get the help. However, work schedules or the car or just some of these resources are so far away depending on where you're at in the city, or where you're at in the region, specifically in Clark County, because we are so large, that gets in the way as well. So future plans, Our future plans, we know that CCSD will be applying for the Federal Mental Health Services Professional Demonstration Grant during 2024-25 school year. That will help create a pipeline for more school-based mental health professionals. The Hope Meets Nevada Roundtable will be meeting, and the grant experts will discuss a potential grant and opportunities, hopefully to fund some state mental health nonprofits. This will hopefully help them continue their roundtable discussions. One of the concerns that has been brought up is when those grants, maybe through COVID or ESSER or whatever they were, when they expire, where are we now? So securing more funding and the grants and creating pipelines and pathways for more professionals to be able to help out in the schools is necessary. And then also looking at funding just in budgets for schools, so that way we can make sure that our schools are fully staffed, whether it's taking a look at those schools who have no school counselor and getting a school counselor in there. There are some schools that have 3 school counselors. Well, how do they do it? Looking at what models are working out there and how can we adjust what we're doing and see if we can match some of that. So that way our students are greatly impacting. Lastly, I want to make sure to thank everybody for your time. I appreciate all the partnerships that are out there working between our Nevada school districts and our community organizations. They aim to improve mental health and to obtain the greatest impact and that increased school-based mental health workforce. We really need to work together and continue to grow capacity. And I can say as a personal note, it's very near and dear to my heart when you are able to help a student who is in need, who feels like they have nobody else to talk to, and you're that one person that can talk to them. It's very hard when you're running around trying to service 500 to 900 kids at times, and you have to say, hey, I'll get to you as soon as I can. That's very hard to say. But I appreciate the opportunity to be able to help spread the word for the need of our school-based mental health professionals. Thank you.
Thank you for the presentation. I know it's been a lot of information, members, so I appreciate you all waiting till the end to ask some questions. I know I have some as well, but we will start up north and we will go to Assemblywoman Anderson.
Thank you, Chair. And I just, again, want to thank everybody for presenting some incredibly upsetting news because I know sometimes it's really easy for us to think, oh, only got to do positives, but if we're going to make changes, we have to look at the negatives too. And so I really appreciate your candor and alarming statistics. I have questions for a few different groups. So how would you like to handle this, Chair? Did you want me to ask 1 or 2 questions and then go back to you? Or I have like maybe 6 questions.
Why don't you just rapid fire?
Great. I will rapid fire then. My first set of questions will go to NAMI, especially with Abby and Laura. I'm sorry, Abby Barnhart, Laura Yanis, I think, and Robin Reeder. Again, thank you for your candor and courage in presenting your personal history. We need to hear that. My first question had to do with, you had mentioned, Laura, about the assembly. And you just mentioned it in your opening remarks about how there was a need for more of the youth peer support specialists and possibly an assembly that could be done at the schools. I'm wondering what ages are you looking at for that? Because that sounds really exciting or really good, but you really were trying to push for the youth peer support specialists. So I'm wondering what ages are you looking at for that?
Robin Reedy, NAMI, Nevada. I'll start off and let Abby finish. I believe she was talking about having an assembly meeting to present the Ending the Silence. The Ending the Silence program, we typically come in and present them to health classes, and they would pretty much be middle school to high school. Those are the ages for the Ending the Silence, and that's where we have a parent that has the lived experience and a student, now 18, but had that lived experience as a student, talking. We actually did, I think, 5 classes up in Reno a couple of years ago before COVID, and it was just fascinating at how the student reactions were and the teacher reactions were throughout that day in presenting back to each of those classes. So I believe Abby was talking about having an assembly type presentation. And again, we're bringing in the voices of individuals who have lived what they're going through now. And then, yes, youth peer recovery specialists. We have the peer recovery specialist program that they get certified. And in the classes that we do, Laura mentioned, and she had to leave, but Laura mentioned about 100 hours of training. They also get certified as community health workers. And it's a way of getting people who are in recovery into employment, doing work that helps them in their own recovery and help people get through their recovery. And yes, Abby is a youth peer recovery support specialist, and I'll let her talk.
Abby Bernhardt, for the record. Yeah, I really think youth peer support specialists are not being as utilized as they should be. When I was young, I had multiple therapists, and I had multiple school psychologists, school counselors. The most support actually came from wraparound coordinators, which in my state at the time was considered a CHW in actuality. But I really needed a youth peer support specialist to tell me, hey, life gets better. This is where you are now, but this is what it could be. I often thought that when a therapist would give me advice or coping skills, I would try them and they wouldn't work. So I got to this point where I was like, well, how can you understand what I'm feeling and how can you tell me this? So I think that the lived experience is a very important component of mental health.
Thank you so much, and how eloquently did you say that? That was such a beautiful comment about the lifted shared experience. And so my other question, if I may just go forward, Chair, with the next one, it had a little bit more to do with Abby's presentation, Laura's presentation, but I have a feeling you're going to know this as well. You state that there were 12 counties currently using the Nevada Teen Text, and the average was 10,000 per month. Wow. The individuals that are responding to those texts, are these the same people that went through the same training that you just mentioned, or are they different trained professionals?
the teen text chat line as well as the worm line, they are trained in peer recovery support specialists, with the teen chat line being within the ages, I think she mentioned up to 28 years old. But again, they are people who have that lived experience, that went through school and then were trained again as peer recovery support specialists. We actually had a grant that was funded by the Department of Child and Family Services that we've been able to train youth for specifically youth peer recovery support specialists. And the teen text line has been able to give those hours, because there's a certain amount of intern hours you have to eventually receive that certificate. So yes, they are trained through that program.
Wonderful. Thank you so much. And again, I just wanted to thank you for all the work you guys do with this. It does make a difference. As a classroom teacher, I see where my students are struggling. And I appreciate as well the time frame of changing it up till midnight. My students do have my cell phone in case they ever need it, and I have received those texts at 1 a.m. So it's, and I know many of us on this committee feel that same way about our kids. So thank you for recognizing the need to have it a little bit non-traditional hours. My next question actually has to do with NDE. So we get to play the change of seats really quickly. Thank you so much, though, for those answers. As you're walking up, I'll ask the question. The first thing, Ms. McGill, had to do with discussion about MTSS and how some schools are using it. I know for a fact that some schools in Vegas are in fact utilizing MTSS. However, that was not included. The whole Clark County was not included. Is that because MTSS is based upon a site-based decision, or is it because the data is not necessarily being sent over to NDE for inclusion?
Christy McGill for the record, Department of Education. So yes, Clark County is one of the districts that is implementing. Not all schools are implementing with Fidelity. And again, there's a couple of ways to implement MTSS. There's kind of, experimenting with it, learning with it, and those kinds of things. And then you get into the true implementation. What you saw, the data that I shared today, were those schools that were actually implementing. But yes, Clark County School District is implementing MTSS.
Thank you so much for that clarification. So I just didn't hear them as one of the districts, so I wanted to make sure that they were in fact part of it. Then my other question, again, with the with your presentation. First of all, English teacher, love the fact that you brought in the conjunction of it's not, or it should be and. So conjunction, junction, not just a great little commercial. But I just wanted to make sure that I've got this right for the clarification of data, both from you as well as from the University of Nevada, Reno, as well as UNLV. With all of the data, you refer to students. These students are attending traditional public schools, charter schools, and private schools. Are they also homeschooled, or is this an opt-in data discovery, I guess?
Christy McGill for the record. So depending on the data set you are referring to, so if it's on the broad level, it is all students, all children, like if we're doing CDC, UNR, and UNLV can probably answer that as well. But when we're looking at health and it's coming from a community-based perspective, it encompass all of those things. When it's coming from an NDE perspective and we're taking it from like the Nevada report card, that is just our students in the public schools and then also charters.
Thank you so much. And so that's my other question, I guess, for UNR as well as UNLV, who utilize data. If you guys wanted to come up to the table as well, because NDE, I'm done. Thank you so much for answering those questions for me. And I hope, Chair, it's okay. I just keep on going. If you could clarify the data points, if it is in fact coming from traditional public schools, charter schools, as NDE mentioned, as well as private schools and homeschool students, or if it's only coming from the public school system.
So for the youth risk behavior survey data, which I shared, it's only coming from the charter schools and the public school system. So we would not have data, and we also sample our tribal schools. So we would not have data from home schools or private schools. We have had some private schools who want to join the YRBS, and we've talked about that, but other schools do not want to. But that would be something we'd be open to for sure.
Thank you so much for that clarification. And UNLV, you're up.
Yeah, David Demore for the record. So we reviewed 3 fact sheets there. It's a mix of data sources. Some of them are all youth, right, under 18. Some of them focus on students in school. So particularly the ratios of the school psychologists, social workers, those are focusing on the public schools, including charter schools.
Thank you so much for that clarification, because I just want to make it very clear that we do have many students that are in transient. And as we all know, the cliff of how many students have returned back to our schools, whether that is in the traditional public school, in the charter school, or in the private sector, has not been the same. And so I have a feeling that some of the data we're getting is not actually as accurate as we want it to be. And so it could be a problem. Sorry, let me get off that soapbox. My last one has to do with staffing levels. So if Dr. Hunt wanted to come up from UNLV, that'd be awesome. It was so great working with you earlier in the last session, Dr. Hunt, with some different things. I'm just wondering, as I look through so many different data of how we need to get more counselors, more psychologists, what seems to be the top 3 barriers with the exception of money? What is the largest issue, number 1? And then number 2, are we seeing more and more of these private-public partnerships where money is coming from the state to hire people, and yet we cannot find them to become state or district employees? So then we have to do a outsourcing, for a better term, for lack of a better term.
Sarah Hunt for the record. Thank you so much for the question. And some of that I may not be the best person to respond to, especially if you're talking about hiring pathways and policies for school-based mental health. I would probably refer more to the representatives from the state professional associations on that. But I think just in general, when it comes to kind of the workforce development in mental and behavioral health in the state, one of the things is certainly for community-based mental health is reimbursement rates from insurance being low. And then even if you are willing to accept that reimbursement rate, it's then how long it takes for that insurance company to reimburse you for the services you provide. There are stories of that taking months, sometimes up to a year or more. And that's very difficult if you're relying on that to, sustain yourself and your family. So those are a couple of big barriers. I think in general, there's been improvements in the state with the pathway to licensure. I know there are still some difficulties, especially in the rural areas. If you're coming out of a graduate program and you often need to have one more year of supervised practice, an internship year, and there can be a shortage of those board-approved supervisors in certain areas. And so then you may not find that pathway back to your home community that you wanted because you don't have someone there to provide that kind of supervision. So that's an area that we want to keep looking at through Be Here.
Thank you so much for that clarification. And I know that my peer next to me also had a question for you. So, Chair, I've only got one more question, but I'll understand instead if you'd rather go to somebody else, since you know me, I've always got questions. I'll let you make that decision, Chair.
Well, Assemblywoman Hanson, why don't you go ahead and ask the question since the presenter's at the table?
Thank you, Chair, and thank you all for being here. The presentations have been insightful, depressing, and I think we're all going to be in need of some mental health support around here as well. Dr. Hunt, thank you for being here. I had a couple of questions, and I would start with, I've got Post-it notes galore. When we were talking about, recruitment, and you've just addressed maybe some of the issues, why we have such a shortage. Could it be some Medicaid, and reimbursement rates across the board in the medical field are a real struggle. I think someone, I don't think it was in your presentation, mentioned that in the K through 12 for school psychologists, that seems to be a difficult recruitment. Am I correct on understanding that is it harder to recruit for school psychologists than per se, we have a shortage already, just even in the community? Is it a little bit more of a barrier to get those to come into the K through 12 space?
Sarah Hunt, for the record. If possible, I may want to phone a friend and see if the representative from the School Psychologists Association is still here. I would rather have them speak directly to that piece. And she is.
She is here, so.
But just if this is kind of the direction you're going at, in K through 12, just in general, when it comes to promoting careers, and that would in mental health, and that would certainly include talking about being a school psychologist, school counselor, that type of thing. Just historically, we have not shown up in that space, not like our colleagues in nursing do, pre-med to promote those career options. But I'm going to stop talking and let the school psychologist come
Yes,
up.
could you come up? I think I can't see you. Oh, there you are. that pillar. Everyone hides behind the pillar, but we'll find you.
Jessica Sharon, for the record. I get excited when I hear school psychologists mentioned, and I'm happy to talk as much about it as anyone will let me, as long as I have a captive audience. So if the question was about barriers to recruiting school psychologists, in Nevada, historically, it's been a very difficult process because there is only one active program for school psychology in the entire state, and that's at UNLV. There is a program through Nevada State University, which will be accepting its first cohort this fall, but there are no programs up north. And so if we have one program that's graduating about 10 to 15 educational specialist level school psychologists, not every single one of them is going to stay in Clark County or in Nevada. Many of them leave for internship and they see greener grass and they decide to stay there. But that's one of the biggest issues that I've noticed as being a school psychologist here in Nevada, is that we don't have enough programs putting students out and making it competitive or interesting for them to stay.
So just to clarify that, even if we said, okay, here's the money and go and hire so we can get these ratios down, there's just not the talent there, which is the idea behind AB 37 was to create this pipeline. Okay, just wanted to clarify that. Assemblywoman Hanson, was that all your questions?
You know me, no. I think I only have two more, but thank you for that, pinpointing it so we could understand why we were really at a loss for recruitment, unless it were maybe to come from out of state. Then this question for either one of you, I think, could answer this. Could you just quickly distinguish between the difference of a school psychologist versus a school social worker versus a school counselor? I'm a boomer. A school counselor, in my mind, is who I went to when I needed help figuring out what classes and was I going to go to college, what was I going to do, that sort of thing. Maybe once in a while could, shed a tear or two. I'm trying to understand, this is a whole new world, and so school counselors, I'm assuming, are more really in the mental health space. Are they doing both? They're doing academic counseling and mental health, or do I have it completely wrong because I'm so old?
Jessica Sharon for the record. So it is very nuanced, and we do have a lot of overlap when it comes to the roles and responsibilities of school psychologists, school counselors, and school social workers. We are all trained in school-based mental health. If a student is in crisis, any of the three of us can provide high-quality supports for a student. We are all trained in social, emotional, and behavioral development. We are all trained in the educational process. However, our specialties are quite different. So a school psychologist, as I mentioned during my presentation, we have a lot of training about special education, law, criteria, and supports, academic and behavioral interventions and supports, school counselors. I'm not the expert in school counseling, but school counselors provide a lot of school-wide supports, a lot of if we think of it in an MTSS triangle of Tier 1, Tier 2, Tier 3, school counselors do a lot of Tier 1 support and heavy lifting. School psychologists do a lot of Tier 2 and Tier 3, and school social workers do a lot of that Tier 3, a lot of that individualized support, connecting an individual student to their resources. And finding those wraparound supports of making sure the whole child, the whole family, the whole ecosystem of that child is supported. So that's kind of how I would describe it. I don't know if there's anything else you would add, or if you have any follow-up question to that.
Sarah Hunt, for the record, I would just say ditto what she said. That was a really good descriptor.
Thank you. That was very helpful for me to understand. And Chair, if it would be okay, I just had a question for Deputy McGill from NDE, if you wanted to move on to my last one.
Okay, and then Assemblywoman Anderson, who is your question for? Maybe we can give the both at the table.
Thank you so much. The last one, my question is actually for Ms. Griffith with the Counseling Association.
Okay, perfect. So Assemblywoman Hanson go first, and then Assemblywoman Anderson.
Thank you. Thank you, Deputy McGill, for being here and for all that you do. So let me find that Post-it note. It was, you had mentioned it. I just have two kind of quick questions. You mentioned in your recommendations the whole child approach. I missed the second one. And then a race barrier for school-based and community-based. Could you recite again what I think it was your second recommendation?
Christy McGill for the recommendation, and thank you for allowing me to say the recommendations again. That's wonderful. So the whole child approach is captured in that multi-tiered systems of support, and making sure that we are doing early intervention. And then the diversification of services. That was the recommendation number 2, to make sure that we had the services that were meeting the student needs. Because we have students presenting with all kinds of different chronic diseases, and so we want to make sure that we have the specific strategy and intervention to meet their needs, so that diversification. And then, of course, the further collaboration with NSHE and Medicaid as well.
Great, got that. Thank you. And if I can find where it was, I know what it said. Oh, there it is. The Center for Disease Control, CDC recommended strategies, it said multiple things, said promote mindfulness. So this is going to lead me a little bit to a comment and then a question. When I think of mindfulness, I think for me and a lot of us, we're distressed by this tremendous increase in anxiety, depression, suicidal ideations, all of it, which all of you are having to deal with once these poor children have come, in my mind, over the cliff. And I'm trying to have us get ahead of that. I'm sure you are too. And so that comes into being some things I've been reading and following about, the influence of smartphones and what that does for mindfulness, right? And what is social media doing to the anxiety and the depression and the suicidal thoughts of our youth. And so I was curious, as a legislator, I'm exploring the ideas about how we can promote more mindfulness in our schools, visiting the idea of maybe phone-free schools or phone-free areas of learning, wondering if the Department of Education has any thoughts in that space. I know we let school districts do a lot of their own work. Is there an appetite or a place maybe for us to address it at the state level to create some mindfulness? And maybe that's not what the CDC means, but that's what I'm interpreting it, so that we can help our youth, have a break and be able to focus on learning, get away from bullying online, at least in their school space, they can kind of be safe.
Christy McGill for the record. Mindfulness is fairly, I want to say new, but I think people are finally coming to the realization the importance of it, and that it is a tier 1 or universal approach. So, for example, we have teachers that are telling or practicing mindful moments, especially like right before a test. Your heart rate may go up. A mindful moment helps calm the heart rate, calm the anxiety, so that you can jump into your test fully aware and applicable. It's really kind of neat to see the teachers and the students in the classroom actually talking about these things. Like, yeah, my heart rate does go up. I am feeling anxious right now when either I test, or, some kids are feeling anxious about not having a partner to sit with at lunch. And to have those conversations right in the classroom itself is a great thing. There's always that balance of what is mandatory and what's not and what's best for the kids, but definitely I think that mindfulness, that social emotional learning, I can't really think of any district or any school that's not doing it already, and really doing a good job of incorporating that into their academics. And it, as you said, it's really important. And it's becoming really important for our schools to be able to have those kinds of connections with our students with the increase of things like artificial intelligence. The content of what we're teaching may change, but the necessary interaction between our adults and our teachers and kids will never go away.
Thank you, Chair. Thank you, Deputy McGill. And I'll give you a pass on my idea of phone-free schools. We'll visit that another time. I know that could be controversial, but thank you, Chair, for the indulgence, and appreciate all that have presented.
Go ahead, Assemblywoman Anderson.
Thank you, and I also want to thank you, Chair, for giving me so much time to ask my questions. My last question has to do with the counseling presentation from Nevada School Counselors Association, Ms. McGriffith. Sorry about that. So the last slide, that's so great that CCSD is applying for the Federal Mental Health Services Demonstration Grant. That's wonderful. Has there been any reaching out, since you are representing the entire state on this, with other districts doing the same thing, or is this only a concentration in Clark County? And also, I wanted to thank University of Nevada, Reno's for bringing forward the tribal schools as well, because we also need to make sure they're included on things. So I was just wondering if this grant is only for Clark County, or if that will be going across the state, since the organization you represent is throughout the state.
Cassie Griffith, for the record. I only have data on CCSD's grant application. Our representative from Washoe wasn't able to make that, so I wouldn't be able to speak with true fidelity on that. I don't want to generalize and give you the wrong information, but we do know that a large amount of our students are in Clark County School District. Doesn't mean that up north is any less important, but I do know that the representatives up there are working closely with entities and trying to get more community involvement to be able to create more resources up north, but I'm just not sure about that grant. Sorry.
I so appreciate that answer, and it appears that Deputy Superintendent McGill is here to help you out.
Christy McGill for the record. Yes. So Clark County is going to specify in their specific needs. This particular grant has multiple awards. Because Nevada's needs are so great, we decided that Clark County should submit on their own because there's a large need. And then that Washoe and the rural districts would submit a grant also focusing on Grow Your Own for school-based behavioral health professionals, working with UNLV's apprenticeship programs, expanding that, also working at more evidence-based strategies for our existing professionals.
Great, thank you so much, and thank you again for the presentation, the time, Chair, and also I want to thank everybody for collaborating with each other in this way. Thank you, Chair.
Thank you. And next we will come back down south, and I will go to Senator Dondero Loop for a battery of questions.
Some comments, some questions. Thank you very much, Madam Chair. First of all, I'll jump into my colleague up in the north asking about school-free or phone-free zones for schools. I just want you to know, my knowledge is that there are schools that have phone-free zones. I was recently at a middle school for a fifth grade orientation for those students coming into middle school next year, and the principal had 3 rules. Take off your hat, put away your phone, and have fun. And she said for the first 3 weeks, there's lots of phones that get stored in her office, and after that, she doesn't see phones. So kids can have them. That doesn't mean that they're out on their desk. So there are schools making progress and making creative solutions for that. I'll jump back all the way to Abby. Shout out to Abby. I want to thank you. Abby and I presented several bills last session together, and she was amazing. And 2 of those bills that Ms. Reedy mentioned, SB 167 and 177, we are still working on. There needs to be some fine tuning on those. But Abby, I think that what I would ask you about is, or first of all, I would congratulate you on all your new positions because I think you're very, very helpful. But I would ask you about what you think was a turning point for you to be a solution and turn your issues into that solution. So what was it that helped you do that?
Abby Bernhardt for the record. Last year, Robin Reedy contacted me to be on these bills. I was going through a lot of different things. Seasonal depression, because that year we had winter for eternity. And I was really struggling with a depression I haven't had since I was very, very young. And I thought I was headed towards a suicide attempt. But believe it or not, when Robin Reedy contacted me to do these bills and do public testimony on other bills, it was that feeling of helping someone and being a solution. And then a youth peer support job was added to that. There's something about every time I share my story, it's very healing and it gets easier to share. But the connection to people that are like me also, and sharing my experience with them and telling them, no, there is hope. Our dreams can be a reality if we keep fighting and keep working hard. That connection is resilience, and it's powerful. And it changed my life. It took me so long to find this point. It took me 26 years. But it's amazing. And youth peer support, along with peer support in general, is the most needed thing. It's the most important thing. It's crucial. Thank you.
Thank you, Abby. And I asked that question because you and I had that conversation as well. And I wanted people to hear that from your voice. I think that kids helping kids and being valued, because I think when you said to me, which I have heard before, that a teacher said to you that you were helpless and hopeless, it hurt my heart as a teacher and a mother, because I found you, when we were doing bills, to be hopeful and helpful, just the opposite. So for that, I am forever grateful. And I think that I'll pull in the bill that I'll pull in Hope Means Nevada for just a minute within this conversation. We did a bill in 2019, I think, with I did a bill with Hope Means Nevada, and those students also testified. And so to have students or to have young people who have struggled testify in these situations is so valuable, because as adults, I don't think we recognize some of the issues that sometimes the younger generation has dealt with. So thank you, Abby, and thank you. I'll be forever grateful for what you helped me to do, and we'll just keep working on all this issue. Thank you very much. And with that, I have one quick question kind of for Dr. Demore or somebody from your team. And I just want to know, we sort of touched on this with the Assemblywoman's question, but is it that we don't have enough students in our mental health programs, or is it that we don't have enough spots? Because sometimes I know it's the spots aren't available, and sometimes it's the students. So I'd like some clarification on that.
Sarah Hunt for the record. So I would say for the most part, we have enough students coming in for the spots we have. Now, could we expand cohorts to, or expand where we offer additional academic programs such as school psychology? Definitely. And I would say what I hear mostly from the current training programs that we have is that they have a lot of applications coming in. They're just very limited in the spots they can offer.
Okay, thank you. And the reason I ask that is because if there's not enough spots, we have too many students, then we want to work on, even legislatively, how we can increase those spots, right? I don't want us to not be training our mental health and behavioral health student. If we can't train them, we can't use them, right? They can't be where they need to be. So the other thing is, just a minute. I'm trying to skip over the ones that I had that were the same from up there. Those questions. Oh, I know what I was going to ask. Dr. Demore, with your presentation, when you talked about, let me go back to this question. When you talked about the mental health in the youth mental health in the Mountain West, and you talked about the ratios, we've tried to work on that within the legislative process. And I was just wondering if there's, talking about the spots now that we just talked about, is there something that can work? I mean, when we say 1 to 1,900, you can't see 1,900 people. You just can't. And it goes back to when Counselor Association, Psychology Association was asked, what's your job really, right? Sort of. You can't be seeing so many mental health or behavioral health students and trying to help other students figure out where they're going to college. There just isn't enough time in the day, right? And then you have to meet with their parents because they're underage, blah, blah, blah. So I was just wondering if there's a way is there something that needs to be done legislatively to help that whole scenario, enough spots, ratios, to help this professional shortage?
David Demore for the record. If you look nationally, you see the Sun Belt in general is low ratios, and I think that has a lot to do with just the growth, keeping up with the growth, one of our fundamental issues there. But I think this is a place, if this is something the legislature wants to incentivize, that this is where the funding formula comes in, right? If this is prioritization for workforce development, that's the place to make that argument. You know, the universities can respond, but if the funding's not there, they have, you know, it's being pulled the other way. So if this is something the legislature wants to see, we need to build these pipelines, we need to support Dr. Hunt's program. That's the place to do it as the legislature revisits the higher ed funding formula.
And the last question I kind of have for you and Dr. Hunt is, when you all talked about how many kids you saw over the years, are sometimes those the same kids that you see, say, that somebody sees in middle school to high school? Or do those actually become different students, or is it a combination?
Sarah,
if I made sense.
Sarah Hunt, for the record, I was just going to ask for a little clarification.
When we talk about suicide rates and we talk about those students that we see, and we have, and I think UNR had a slide on it as well, and we see the kids in middle school, and then we see the kids in high school, and we see the years versus the percentages. Are those the same kids that we're seeing, or do those become different students that have suicide attempts? Obviously, completion would be a different category, but suicide attempts.
Sarah Hunt, for the record, that is a really good question, especially with the data that UNR presented. So, and I'm not quite sure if they would know on their end if they're getting repeat students submitting responses to that. And I would also defer to my colleagues from school psychology and school counseling here, but my thought is probably you do have a certain segment of those students that will have those repeated attempts or repeated ideation that may be just associated with the mental health conditions that they have. And then certainly we know there's a certain group of individuals, adults, youth, that will have maybe a one-time episodic something in their life that is very difficult, very traumatic, and it could lead to that thought. But through, you know, proper help and treatment and assistance, maybe they don't have that again. So if that helps, that's probably not clarifying maybe as well.
Well, I know that you know, even when Abby and I talked, you know, that sense of belonging, right? I mean, that was her story. Once somebody valued the story and said, come help us. So that sense of belonging is very important. I know as a parent, I always felt like that was why it was so important kids got involved in school, something. I don't care if it's choir, football, the French club, right? Something, because they have that belonging, they have that commitment, and they have friends within that group. So I thank you very much. I thank you for your time, and I thank you for your presentation. And then just one last comment, I believe, Chair, and that is from our school counseling and school psychologists. We have worked on bills with ratios. I would ask you, is there something that would help you? Is there some solution, or do we just need more people as well?
Jessica Sharon. I'm sorry, I thought it was just a question. I would have started walking up sooner. My understanding and my interpretation, I know that that ratio bill was so critical, and we've been taking that back to our national association of like, this is something really great that Nevada is doing, but there hasn't been accountability really in increasing the number of school psychologists that are here, the number of counselors. One of the things that I mentioned in my presentation that I think would be really beneficial is some of our professionals in at least in Clark County, I can speak to because I work here, is that there have been, like we've been saying, oh, we're fully staffed, and it's because all of the full-time positions that are posted are filled, but our ratios are still quadruple what they should be. So really, the thing to do, from my perspective, is to increase the number of full-time positions that are available. Even if they go unfilled, I mean, they've gone unfilled before, and it wouldn't, be something brand new that's happened. And, I'm not a financial guru. I can't tell exactly how a school district should be running their budget. But I think that one of the first steps is to, increase the number of positions that are available to apply for. That way we can say, okay, the goal is to actually attain this ratio. We can't do that with the number of positions that are currently available in the district.
Cassie Griffith for the record. As far as counselors, I can speak to what's going on here in Clark County. One of the barriers is that possibly, again, there has been great strides made, but like, for example, NRS 388.055 says the clause to the extent of what the funds are available. So again, making those funds available. There's also a numbers game where you look at enrollment, and there's a magic number where you get a half-time versus a full-time. And then the responsibility becomes the school to work around and figure out what teachers do I not need, what staff do I not need, so it becomes a conflict. And as an administrator, that's a very hard position to be in because you only have so much in your pot. How do you spend that money effectively and make the most impact? So looking at that numbers game, whether you have 300 students versus 500 students, is there less of a need for a full-time counselor versus a half-time counselor? So that's something I know that legislative has worked with, the school district and making assembly bills, and we appreciate the work that you've been doing because at one time there was no mandate for a mandatory school counselor. So we appreciate the strides that you've been making for us. Thank you.
Don't go. Wait.
Thank you very much. And I'll get with Dr. Dockweiler and we'll fine tune that bill. Thank you very much.
Thank you. And I just have a couple of questions and then we'll end. I know we could ask questions all day. This was a lot of great information. I am curious if, like speech pathologists, if counselors and psychologists see students from private schools as well. I know I'm getting yes, they do. But could you? So, in addition to the schools, that if you have a part-time position, you will then see private schools or as well.
Cassie Griffith for the record. So, speaking from people that I know, they have went outside of the district, and that is why sometimes we do lose other people, whether that's the speech pathologist, the psychologist, the counselor, because they can make more money outside. Is that what you're speaking
I'm sorry,
of?
no.
Oh,
To
okay.
clarify, a speech pathologist that I know not only sees her students at her school, she also sees students from a Catholic school nearby, some homeschooled students come in and get her. So I was just wondering if that was part of on your plate as well.
Cassie Griffith for the record. Sorry about that confusion. So I do know that like our speech pathologists do have students from outside come in and they do see that that is on their caseload. I don't have their actual numbers in front of me, but I do know speaking on a council for people and other licensed personnel, that is a major concern for them as well. So it is happening. For myself as a school counselor, I typically see my kids that are just in the school, because we have such large caseloads. We don't really have like a student from another school coming, but speech pathologists do. Thank you.
Jessica Sharon, for the record. From the school psychology perspective, yes, private school evaluations are done by school psychologists in the local zoned district. Different districts may handle it differently. I do know in Clark County that is part of the Child Find Project Department, where any like evaluations are done outside of regular contract hours, but they are Clark County School District school psychologists doing the evaluations. If the student is eligible for services and they attend a private school, it is the responsibility of the local district to provide those services, and any reevaluations would also be a part of that. But as far as mental health supports, I don't know of any school psychologists that are doing that type of work. But yes, any sort of special education responsibility does fall on the local district.
Thank you for that clarification. So the ratios are actually a little bit higher than even what we see. Thank you. I'm going to end with Dr. Beavers, if you would come up. I was very excited about this pilot program that 2023 to 2025, and I assume that the idea is that this will be scalable, and then you can, after that those 2 years, we can get it out throughout the whole state or possibly Clark County at first. Tell me what this looks like in 2025. Now, do we have to go back and figure out if it works? I mean, it looks to me like it's going to work. I mean, it just is a really, really smart idea. But will we be able to, if the funding is there, to be able to roll this out immediately and get this? Because I think this is a way to really address the chronic absenteeism problem.
Kellyanne Beavers, for the record, thank you for your enthusiasm and interest in it. And I agree. And one thing that we are going to integrate with our process in hopes that it will be easily reproducible or refinable at the end of the pilot program is a specific approach to program evaluation early on. So the cooperative extension at UNR has a specific collaborative partner that we have, and her expertise is program evaluation. So first of all, the first year of the grant will be completed this summer. The second year will begin midsummer, and that's when we'll start working intimately with the schools. This first year was building the asset map and building the relationships with the specific schools to secure the contract. And as we actually work with each school to understand what are their needs, how do they envision the program unfolding? Because there's some of that, being sensitive to what staff, for example, actually is available at each campus, and how Dr. Carney and his graduate students can best integrate with the work they do. I mean, we'll have weekly check-ins regardless, but the process might look slightly different from, the pre-K campus or the kindergarten and first grade campus. So I think having that program evaluation element will allow us to have a very clear plan from the beginning as far as what we're going to assess ourselves upon and what we're going to reflect on at the end of the pilot as far as reproducibility. But I also know that Dr. Carney's been thinking about this for a long time. This is a vision that he has and is pursuing an additional grant toward. So he has a lot of expertise in how to ensure that it can be successful going forward. So, anecdotally, I do think that that is being attended to, but we also have folded that into our process, ensuring that it can be sustainable.
That's great. Thank you so much.
Thank you.
Okay, and with that, we will close this agenda item and go to one more agenda item before lunch. I know we're a little bit behind, but I do want to hear agenda item 5, presentation of work, activities, and function of the Nevada State Board of Education. And do we have 2 presenters or 3? Just 2. Okay, so we have a former colleague former Senator and Assemblywoman Maggie Carlton, and Tamara Hudson from the State Board. So please go ahead when ready, and thank you for being here. And I hope you guys got some good information to take back to your board as well.
Good afternoon, instead of good morning. I'm Tamara Hudson. I am currently a teacher in Clark County, special education in Clark County. I was appointed by the Speaker of the Speaker of Assembly to be part of the State Board. I currently also specialize in behavior at my school at this time.
And thank you, Madam Chair, and members of the committee. For the record, former State Senator, Assemblywoman Maggie Carlton. I was appointed to the State Board of Education January of 2023 by the former governor, and I'm very grateful. When I got the phone call, first thing that went through my mind was, oh my gosh, more education. But then I decided that the best way to continue following up all the work that we've done over 20-some years in education was to be able to be part of the Board of Education. And I never got to sit on an education committee in the legislature, so this was kind of filling out my bucket list a little bit. So I was appointed as the governor's appointee to industry, so I've had some wonderful predecessors, and I have been reaching out to different members to represent them. So I am here as backup. We apologize that some of our elected members could not be here today through work schedules and illness, but we will do our best to present a 60,000-foot view of the Board of Education and try to answer any questions for you, and whatever we can answer, we'll make sure we follow up on for you. Thank you, Madam Chair.
So to start off, just some of the things, our vision for this year, we changed it a little bit to mimic what we see in our students. And it's basically, we want our students to be equipped and empowered to attain their success based off their needs. The State Board is comprised of 11 members. That changed in 2013. There's 7 voting members, and then so there's 4 elected and then 3 that's appointed. I'm the teacher voice in that on the board. With the appointed, then the governor, the Senate, along with the Assembly gets to appoint, and then our non-voting members is usually a district trustee, along with a district superintendent, someone from higher learning, and then our student voice is on the board as well. Our board's role is to set statewide educational policies for our state. It operates between the legislator and the local school district, but the job changes so often depending on every session. Our goals sometimes change, but our main goal is also always to advocate for all students. When it comes to the State Board's responsibilities, we have, and I think you should have that handout with our Nevada Administrative Code, and that's the NRS 385 through 394, along with setting the Nevada state standards, including our CTE, our career technical educational standards as well. With that, we are responsible for setting accountability and doing our statewide plan for the improvement of pupils, along with setting those graduation requirements. With the partnerships, we partner with our state superintendent, who is appointed by the governor and then runs the Department of Education, with the Department of Education, who supports the employees, and they support what our superintendent and along with our education incentives are. And then we have the Attorney General's office that provides the legal counsel and support for us. When it comes to the state standard, basically we're just there. There is a process that we do. When we define what students must know and do in core subjects, we don't really focus on the curriculum aspect of that, but we do approve some when it does come forth to our board. When it comes to the CTE standards, those are developed by the Nevada Department of Education along with individuals that's in those industries. And then they're approved by the state board. When it comes to accountability, this is a big one, which is we do test selection to make sure we follow the ESSA along with our state level assessments as well. And that's the selection process. When it comes to our cut score setting, we do level setting, policy setting, along with we counsel to establish the academic standards as well. And that all goes through the state board for approval. And then we have ongoing review for those evaluations. So with that being said, there's 2 bills that just passed, and I was trying to look up, but I think it's SB 99 and AB 400. Hopefully I get those back with you. But those are 2 bills that now have the Commission of School Funding also holding accountability. So it would be nice just to know what we can do to assist you guys so we won't be double dipping when it comes to or doing double the work when we have 2 entities that's working towards the same goal. So with when we're starting to meet on the accountability aspect, just to make sure that we're both in line on what is the goal at hand. And of course, we always know is our students here in Nevada, just to make sure they're successful in achieving greatness, because that's who's going to be our future leaders. And then our statewide plan for improvement of pupils, which is the STIP plan, that is a 5-year goals. We do hold yearly, get updated yearly. It does change between the superintendent, so sometimes it's different approaches when it comes to it, but it's driven by the state board's goals along with student outcomes, and then we adopted the state Silver State governance to also make sure that we're more focused on the inputs and not always the output. So focusing on student outcomes and not people behaviors. Other responsibilities that we have is the classroom size reduction. And then how to we have to review and reprove some of those plans, as well as the private school license and instructional materials is under our umbrella of approval as well. And that is it for us.
And thank you, Madam Chair. So, you know, that 60,000-foot view and the mission and the call that I hear when it comes to the State Board of Education is that all children birth to 3rd grade have access to quality early care and education. It starts when they're very, very young, and we know that. The more we've gotten to all-day K, the dream is all-day pre-K, the sooner that children are being educated, we just feel like, you know, we won't have to worry as much about the back end on the big question right now over this next biennium is going to be read by 3, which is something that the board is taking on and has set up a subcommittee on, and I'm very happy that I'm going to be able to participate in that since I've been around since we started talking about read by grade 3. And I think the other really important thing that we look at is that all students, no matter what zip code they live in this state, have access to an effective, well-trained teacher that can do the job in the classroom. I have heard, since I have been on the board, a lot of concerns about long-term substitutes. I've had a number of people reach out to me. I've heard it in just community meetings, and I think it's something that our board eventually, and hopefully the legislature, can start looking at and evaluating. We want to make sure that we have that quality, effective teacher. Former Senator Woodhouse repeated that so many times, I think I used to hear it in my sleep. A quality, effective teacher in every single classroom for every kid in every zip code in this state. So I'm very thrilled to be able to work with this board. My term ends at the end of this year, so I have a lot of work to do in the next 6 to 7 to 8 months. I believe one of the priorities of the board, I cannot speak for the board officially, but knowing that when we reviewed the bills from last session in one of our previous board meetings, a lot of conversation was around read by grade 3. So hopefully a lot of the work will be done around that, and I'm happy to stand for any questions that the committee might have, except from Ms. Anderson up north. I'm not going to take any questions from her.
Thank you very much for the presentation. And I agree with you that the return on investment in starting kids early, read by grade 3 really starts, when the child is born. You are the parent is your child's first teacher. So, couple questions. Well, I'll just ask it. So you are a hybrid board, which we've been hearing a lot about lately, and I'm just wondering how you feel that hybrid board. Do you are there limitations besides voting? Can you make motions? Do you work well? Do you play well in the sandbox together, or is there any issues that you would say?
I believe, for the record, Maggie Carlton, member of the Board of Education, and to make sure I said the right thing there, we all work very well together. I think one of the most important components that we have is because we do have some folks that are elected. They have a different term, which I believe works out very well because you've got other folks that just have 2-year terms. So there's never this total institutional loss. You have enough rotation through it. Having all 4 of them up at the same time is difficult, but they're all tied to congressional seats, which run. So it's kind of an oddity. If that could be staggered, I would recommend a little more staggering. I think one of the most important members on this board is the student member. And I think one of the things that the 17 school districts in this state could do is put a student member or a couple of student members on each school district board. He has been wonderful in bringing ideas forward. The perspective has been great, and I really enjoy having him on the board. We all work together. A motion is made, it's seconded, there's conversation. None of us are treated any differently than others. I honestly, until I took a look at this, I really didn't see people in different categories. We're just a board working on the agenda that's in front of us and trying to get our work done. So I think it works out very well. Now, when I possibly don't get reappointed, I may have another opinion, but we'll cross that bridge when we come to it.
Tamara Hudson for the record. And just speaking from a teacher aspect, I like the hybrid more so because when I don't get coverage in my classroom, I'm still able to have a value. Like if the students, we're still part of that conversation. It doesn't really take from it. And second her, like our board is, I hate to say it, like I don't want to be biased, but it is wonderful. I was like put on in between someone's, she retired, the teacher before me, and then I got appointed again. So they just took me in, and it was nice to see like the voice of the student and the teacher being heard. And that was the first time of ever having someone take our thoughts and considerations to heed, like listening to our problems, actually trying to problem solve to make sure the system is better and not. So it was like eye-opening moment just to say like, oh, it's not because of you. It's not your fault. So the communication and transparency became more open to me. So then it was nice to be able to bring that back to the schools that like lost hope in the system. So overall, it's been wonderful.
Thank you. Thank you very much. And it occurred to me that the last time we actually had all our teacher positions filled in Clark County was 1996, which I think would have been just before you started your tenure, so we can't blame you. No, no, I'm just teasing. But I mean, if that doesn't just sort of put it, that's the last time we had all of our positions filled. So we have some work to do, and I feel good with you guys at the helm. So thank you very much. Members, are there other questions? Okay. Assemblyman De Silva.
Thank you, Chair. And Senator Carlton and Ms. Hudson, it's always good to see you. Thank you for the great work that you're doing there on the State Board of Education. My question is about a subject that I know that comes up often in education, and that's standardized testing. I was wondering if you've been having some conversations as a board about reevaluating and maybe tweaking around our approach to standardized testing, or is that even happening? Just wanted to just get your perspective on if there are any sort of conversations taking place about standardized tests at the school board level. Thank you.
Okay, I would say, Member Tamara Hudson, for the record, sorry. We are having those discussions. A lot of things have came to our attention about the development of our students, along with some cut scores and age requirements. So especially when it comes to our special ed students and how we support them in the school, our pre-K. So those conversations are being had. We are even looking at policies of what we could do to change age requirements, what other supports is needed for our students, especially when it comes to the attendance requirements. Even with Nevada, you have to be 6 to start in school. So pre-K and kindergarten is not really a requirement here. So just looking at those aspects that kind of like put our test scores behind, those conversations are being had, and we're looking and see what we can adjust, what tests will best suit our students as well, to meet the diverse needs as a whole as well.
And if I may add, the conversations, Maggie Carlton for the record, the conversations about what vendors we use for tests. We had a number of conversations. We had to send them back a couple of times to make sure that as they evaluated our students, that they were looking at the criteria that we thought best sought to get the answers and the data that we wanted from those tests. We're not going to let the vendor write the test for the kids. We're going to ask that the test we do is the one we need for the children in this state. So we did have multiple conversations with the vendor on how to go back and reevaluate those tests and what numbers were looked at. You can't, and this is going to sound very strange coming from the former chair of Ways and Means, but you do get what you pay for, and we didn't want the lowest bidder because we wanted to make sure that the test that was going to be given to the students really gave us the data that we needed. So we asked them to go back and reevaluate that. So
I'm so sorry. I do. Thank you for reminding me. Tamara Hudson. We also changed our rubric on how we would have those vendors come to us, or how to pick the vendors as well, because the questions were basic and have been in Nevada and our students are very diverse. A lot of the times the test didn't mimic what we wanted for our students or didn't best service our students. So we even had to look at what we were asking the vendors and why. So what we were asking the vendors to make sure they were even being able to service our students. So we did go back and even redid that whole policy and align our rubrics to what our needs were for our students.
Thank you. And despite your objections, Ms. Carlton, we are going to Assemblywoman Natha Anderson up north.
Yay! Thank you, Chair. Thank you for ignoring the former senators and assembly members' request. Thank you so much for the presentation, and also for both of you. It's wonderful to see you both, and thank you for your volunteering, because let's be realistic, that's what you're doing on this board most of the time, towards our kids. My question is very similar, actually, to my peers from the South. Last meeting, we discussed for some time about testing. And slide 9, you mentioned about test selection and about how, because I love the phrase that you utilized, the double entities when working on the goal at hand. There's a way for us to be able to get away from that. So I'm just wondering if there's been discussion around possibly taking away some of those tests for our third graders in particular when it comes to the SBAC and the MAP test, as well as 3 others that appear to be the same. Because as Superintendent Young brought up during our last meeting, this stress is really creating problems for our students in the third grade, and that mental health, as we just heard, is we need to start at really looking into this earlier. So I'm just wondering if there's been any discussion about how we can combine some of these tests, or if that's more of a department decision.
Madam Chair, if I may, I don't believe that it would be appropriate for either the clerk of the board or myself as a member of the board to speak for the board on this issue. I know some tests are mandated at the federal level, others are done in different ways. I think that's something that we should take back to the full board, possibly ask the superintendent and staff and president of the board to put it on as an agenda item and move forward from there. I don't believe it would be appropriate of us to opine on that right now, but I can just tell you, I was the kind of kid that, had the nervous stomach and they had to yank into the classroom to take a test, but yet I knew what was there. So, we're going to have to take a pass on that one for now. Thanks.
She was bound and determined not to answer your question, Assemblywoman Anderson.
She
said
promised
that.
me, right?
I'm totally teasing. No, I think that's a great idea, and we'll watch for that agenda item. Assemblywoman Anderson, did you want to?
I just wanted to say thank you, and I didn't mean to interrupt you, Chair. If you take a look at our minutes from last meeting, it's on page 36 where the very specific information is asked, and then Superintendent Young goes into this as well. But thank you for the very diplomatic way of saying, I wasn't going to answer your question, Anderson, so well done. Thank you, Chair.
Thank you, Madam Chair. It's not my first rodeo.
Thank you, and thank you very much for being here, and we will see you soon. Keep up the good work. Okay, so it is 12:50. We are going to take a 30-minute break, so we will be back at 1:20 with agenda item 6. All right, we'll see you soon. We are in recess. All right, we are back from our quick lunch, and we are ready for agenda item 6. We'll hear a presentation, updates on restorative justice in Nevada schools. There have been several legislative members passed on this topic during the past few years. I still have a little PTSD, including Assembly Bill 285 and 330 during the 2023 legislative session. We'll hear from NDE and school districts. We are going to go a little out of order because we have some folks who need to leave. So we will start with Dr. Mike Barton, Dr. Samuel Scavilla, and Mr. Kevin McPartland with Clark County School District. So come on up. And it looks like we have extra. Would you like one of these chairs? It's taller. Okay, so please go ahead when ready.
Madam Chair, members of the committee, for the record, Brenda Larson Mitchell. I serve as the interim superintendent for the Clark County School District. Thank you very much for having us here today. We're very appreciative to share with you the work that we are doing regarding restorative practices. With me this afternoon, I have Dr. Mike Barton, Dr. Sam Scavella, and Mr. Kevin McPartland. Thank you.
Thank you, Madam Chair, members of the committee. Again, just want to say, first of all, we acknowledge and appreciate our partners with this work. As I was listening this morning, mental health being a collaborative effort, we also feel like with restorative practices and the work that entails this work, it involves multiple partnerships, including the state legislature, the Nevada Department of Education, et cetera. But I would like to, do I need to pull a PowerPoint up? I apologize, Madam Chair. Do I need to pull the PowerPoint up? I'm sorry. Oh, okay. I'm sorry about that. All right, thank you, Madam Chair. So, yeah, again,
You have the superintendent working for you?
We need to switch seats. No, we need to switch seats.
I'm just
Madam Chair, I'm a team player. I do it all. No worries.
Thank you, Interim Superintendent. Yes, it is. So, thank you, Madam Chair, members of the committee. Again,
I apologize. You probably wanted to put it to full screen. It's coming.
Thank you, Madam Chair. So again, this is all about partnership, and we acknowledge many of our partners with this work. We received from AB 285 and 330 of the 82nd session. Work started to happen with the Nevada Department of Education through fiscal support. That was inclusive of about $1.86 million from ESSER Relief 2 and 3 funding. That has been critical funding for us to implement the work that you're going to hear about today, so thank you. And then secondly, the partnership has not stopped. So you'll also hear about another layer of financial support that has come from, legislature to Nevada Department of Education through about $1.3 million of ESSER 3 funding at that state level that is helping us with progressive discipline based on restorative justice grant that we're actually at a stage of implementing right now and actually starting this afternoon. Also, just to go over what is our main work with restorative justice, again, thanking everyone that has helped make the financial contribution happen. What did we do with that money? We started by working with a international partner that I know has done a lot of work with NDE, but also we signed up with them as well, International Institute for Restorative Practices, a respected, reputable name around what it looks like to embed practices in your schools regarding restorative practices. Now, when we had that consultant work with us, where we've continued that engagement, we've instituted on every single campus a restorative leadership team. So you notice on that slide, upper right quadrant, that every campus in the Clark County School District has a restorative leadership team made up of approximately 3 to 5 professionals. That can include support professionals, administrators, teachers. And then every restorative leadership team and every campus also has one identified culturally inclusive champions. So that's an upper left quadrant. We call them CIC for short. But that person is our main link with our central services department under the leadership of Dr. Scavella, who really is involved in that train the trainer work. Because again, we've got to build capacity around this work to ensure that schools can do this and do it effectively. And then we have two other pieces of the puzzle that you see there today, putting theory into practice as these teams are trained by IIRP, the International Institute of Restorative Practice, and our central services team. We have many touch points throughout the year where they're able to have an opportunity to put this theory into practice on their campus, where it's differentiated. We know every campus around restorative practice is a little bit different. And then finally, we have also identified the exemplars in our system. We have restorative practices model schools. We have approximately 10 schools, and then we have 10 classrooms that's what it's all about. That's where we have identified them as a system where other schools, other classroom teachers can learn from our model classrooms and our model schools. I also give you a little bit of data on that right side right there. Cultural competency is the backbone of a lot of this work. So as we do restorative practices with our building capacity and train the trainer model, we also need to ensure that all of our employees in the Clark County School District are trained on cultural competencies, recognizing your own bias. How can you be effective with all students? What are the great assets of all kids? So that number there actually, that keeps ticking up every day. So when we submitted this presentation, it was at 23,700. I believe it's gone up by about 700 more people who have been cultural competency trained, with the deadline being in June. And then across the board, restorative practices trainers, administrators have been trained, 1,351. So again, just wanted to sort of build a picture of what we're doing to build that capacity. And I went over this, but this is really our framework as a Clark County School District, putting a lot of value and resources, professional learning into our CICs, our restorative leadership teams, and ultimately we build that system capacity. Madam Chair, with your permission, Dr. Scavella, who again leads a lot of this great work from his department, the Equity and Diversity Education Department, will provide an overview of the data and how this is starting to make an impact on restorative practices being used, and also how that's influencing our discipline numbers.
Thank you, Dr. Barton. Madam Chair, members of the committee, Sam Scavella, Assistant Superintendent of Equity and Diversity Education, for the record. What we see on this slide is our third quarter restorative interventions analysis, and this shows that we are in an upward trend in using restorative practices across the district. So school administrators, and we track every time there's an incident, whether there's a behavior event, and we always track our behavior resolutions, and that's how the actions of the administrators and how we address those behavior events. So to date, we've utilized 16,671 restorative disciplinary practices as behavior resolutions for this year alone. So these practices also include restorative circles, restorative conferences, restorative tribunals, peer mediation, and also something as simple as apologies. So to assist schools in meeting the requirements of Assembly Bills 285 and 330, the Progressive Discipline Based on Restorative Justice initiative combines progressive discipline with restorative approaches when addressing behavior to prevent a reoccurrence of that inappropriate behavior we sometimes see by helping our students take responsibility for their actions while they're repairing harm through these processes. And collectively, we find solutions to resolve conflicts before they become a referral, because once they become a referral, that populates our discipline data. So again, this initiative blends that progressive discipline and restorative practices through the use of an evidence-based tiered framework that you heard Dr. Barton speaking to. And this is going to help students with their behavior, academic, social, emotional, and also mental health needs. And our goals for For our new PDRJ, which is our Progressive Discipline Placed on Restorative Justice Initiative, is to eliminate as much as possible our discipline disproportionalities, as evidenced by our suspension and expulsion data, decrease the incidents that we have on our campuses in terms of those behaviors, and improve our school climate as evidenced by several surveys, the Nevada School Climate, Social Emotional Learning Survey, and so forth. So creating a comprehensive professional learning series to address disproportionate school discipline, it really requires a multifaceted approach which combines several evidence-based strategies and programs. So when we're working with our district, we're working with up to 50 schools for this initiative. And the curriculum that we have outlined, it outlines and incorporates positive behavior interventions and supports, behavior modification and management programs, social emotional learning, restorative discipline and practices, cultural competency, as you heard Dr. Rardin speak to, and also implicit bias training. So again, our first session, Module 1, will begin this afternoon. And with that, I'm going to pass it to Mr. McPartland.
Thank you, Dr. Scavella. Madam Chair, members of the committee. Oh, yeah, one more. Okay, thank you. Madam Chair.
I think I passed it too soon. Okay, I passed it a little too soon, Madam Chair. Sam Scavella for the record. We want to just identify some of our root causes for the discipline disparities that I spoke to in regards to disproportionality. And it's important to look for patterns in the data that go beyond the individual cases, but we really can't stop there. We have to really look at the whole story when we're looking at disproportionality. So many root causes may not be immediately apparent, but such as the lack of support that we need for educators understanding of student behavior, making sure our educators' needs are being met in terms of building their skill sets to prevent and address sometimes those misbehaviors that we see that evoke sometimes the punitive or those exclusionary responses. And also to really take a deep dive like we're going to be doing this afternoon in explicit and implicit bias, and a need to really acquire that knowledge and skill set to use positive approaches and those de-escalation strategies to address those behavioral incidents that we sometimes see on our campuses. So I spoke to the goals of our initiative. Being that we're looking to eliminate the disproportionality and making sure that we address with fidelity those behaviors that kids sometimes get into conflict, but it doesn't have to become a disciplinary issue. So again, working to improve our culture, improve our climate. Every day, one kid at a time, and this is what our restorative leadership teams on a proactive level are doing in our schools today. They are training the staff in these restorative approaches to make sure that everybody is using those processes to build those relationships and then involve students in the conflict resolution process so that we can be solution oriented. So that's basically where we are in terms of some of our root causes for this, for our disciplinary outcomes of disciplinary disproportionality. And with that, I'll turn it over to Mr. McPartland.
Thank you, Madam Chair, members of the committee. Kevin McPartland, Associate Superintendent of Education Services Division for the record. Dr. Scavella and I are attached at the hip in this work, so this is very appropriate that we're in here. So as we strive to increase the frequency and effectiveness of restorative practices in our schools, our district's Focus 2024 plan, a strategic plan, calls for us to track student suspensions, discretionary expulsions, with the goals of decreasing the overall numbers and reducing disproportionality across all student groups. While there's still work to be done, we are pleased to share that through the first semester of this school year, we've seen a 7% decrease in overall student suspensions compared to last year. I'd like to highlight that at the high school level, we've seen an incredible 32% decrease in suspensions. While we set targets for disproportionality, 32%. Sorry, I apologize, for high school. When we set targets for disproportionality, we set them as ratios of suspensions per 1,000 students in each student group. We have decreased the disproportionality ratio for 7 of the 8 student groups tracked within the Focus 2024 strategic plan. The one student group that did not decrease this year, which is the Alaska Native American Indian group, is actually still below the targeted levels set prior to COVID. Within the Focus 2024 strategic plan, we also track discretionary expulsions, which are non-mandatory expulsions. For this, we use the state's definition of mandatory expulsions, which relates to the possession or use of a weapon. Any expulsion for any other reason is considered discretionary. We've seen an overall decrease of 11% in our discretionary expulsions during the first semester of this year. Outside of our Focus 2024 plan, we also track 1- and 2-day suspensions, as these are historically a response to minor and less severe student behaviors. We're pleased to share that for this, we've seen the 23% decrease in 1- and 2-day suspensions, which shows us that for these less severe and minor offenses, our principals are using less exclusionary and more restorative practices to address these issues. While we focus on prevention, interventions, and consequences, we understand the need for students to be held accountable for escalated or more severe behaviors. We do this to preserve safety and help students understand the severity of the impact of their actions. This is done in a number of ways. We use suspension with instruction, which is an exclusionary practice that maintains student connection to classroom instruction as a response to behavior. We also have many schools that have what we call, it's a Schools Targeting Alternative Reform On-Site, or a STAR-ON program. This is a temporary placement of a student in an on-campus program where students are not permitted in their regular classrooms, nor do they participate in their usual passing period or lunch period. Instead, students are in a program similar to an in-house suspension program where teachers often rotate out to them, so they provide instruction in that environment, and they receive breaks and lunches at a time when the rest of the student population is in classes. When students are removed for exclusionary practices, we focus with schools on reentry plans. So when students are assigned and returned from exclusionary discipline, we focus on safety plans, interventions, restorative practice, plans for repair if they're appropriate. So even if we're excluding them, we still offer a restorative practice upon their return. For our more severe behaviors, we have academic centers, previously called behavior schools, where students can be placed for up to 9 to 18 weeks in an alternative setting, depending on the infraction. We also have students that as part of our re-engagement process, or re-engagement students. These are students who commit a severe, dangerous, or violent act and receive a police citation. For these students, we have the 9 or 18-week assignment at an alternative school and a mandatory referral to the Harbor, which is a juvenile assessment center, or a substance abuse awareness program, which we call SAP, depending upon the offense, as an additional term of their re-engagement back to school. The Harbor, which was developed through our school justice partnership with Clark County, leads to referrals for additional resources for students and families. The SAP program is led by our CCSD Department for Safe and Drug-Free Schools. We also have our Nevada Virtual Learning Academy Academic Center now. This is utilized for our most severe, dangerous, or violent situations. In these cases, students would be removed and attend a virtual learning environment for 18 weeks with the re-engagement processes we talked about at the Harbor. Then they return and there's a review, and if the review is successful, they have 18 weeks at an academic center. If there's another review, then they may at that point return to a comprehensive environment. Whenever we do any type of exclusionary practices, we always look for a change of placement to see if this option is appropriate, taking into account the disruption to the campus or victims that might be on the campus as well before a student would ever be returned to their comprehensive school. We want to share with you some of our community partners that serve on our superintendent's Anti-Racism, Equity, and Inclusion Advisory Committee. This committee meets quarterly to provide insight into racially motivated incidents and analyze inequities in the district and at specific schools. As you can see, we have the Anti-Defamation League, Clark County American Asian Pacific Islanders, Clark County Black Caucus, who was here, Israeli American Council, Make the Road Nevada, My Brother's Keeper, the National Association for the Advancement of Colored People, No Racism in Schools, hashtag 1865, who also was here today, Power to Parent, Youth Power Project, and the 100 Black Men of Las Vegas. Many of these groups engage with us on a more frequent basis as we work to maintain these important community groups as partners in the work of educating the students of Southern Nevada. These partners also include Communities in Schools, Boys Town, and the Children's Advocacy Alliance, working with us on a number of projects. With that, this concludes our presentation. We will now take any questions if you'd like.
Thank you. Members, I'm sure we have questions. I know I do, but I will start. I'm looking at you, Assemblywoman Anderson. I assume you have a question as well. Yeah, she's giggling. I will start with Assemblyman De Silva.
Thank you, Madam Chair. And thank you for your presentation. It's always great to have the leaders of our district here in our committee. I have a bit of a complex question here. So the first question deals with the discretionary expulsions. What exactly is that? How does that really work in our district? My second question is about academic centers. What kind of infractions are we seeing? In those at those centers. What kind of students are being sent to those centers currently? I know that there's been a lot of movement, in regards to like who we're sending to academic centers, which students, I should say. And then thirdly, I saw the list of community partners there, and I was wondering where the teacher voice was. I was wondering if you've done work with teacher organizations, particularly CCA, who was very instrumental in moving this legislation, Assembly Bills 285 and 330. So I was wondering if you've worked with the teachers union too, and making sure that both these bills have been implemented properly. Thank you.
Mike Barton, for the record, through you, Chair, to thank you. All right, Assemblyman De Silva, I'll answer the third part of the question, then let Mr. McPartland take the first two parts of your question. So we definitely want to make sure we're collaborative with these efforts. I know that we've been, under the leadership of Dr. Larson Mitchell, building bridges back with our bargaining unit for teachers. I know that we've had meetings with Dr. Pearson, with CCA. Is there more work to be done to ensure that we have teacher voice around all of this? Yes. So we're definitely at a stage of building bridges back with some of our critical partners that help us shape this work. But I think that it's at a stage of infancy, but I would say we'll have a better report on that in probably a few months.
Kevin McPartland, for the record. So regarding the first part of your question, discretionary expulsions. So for discretionary expulsions, that's where we're looking at where there's a battery has occurred, whether staff or student with injury. We're looking at threats, sexual assault, distribution of controlled substances. These are the things that are on our list where schools will still recommend for discretionary expulsion. The way that process works is, again, it is adjudicated at the school at 2 levels, then to a region director, and then it could go to a hearing panel, which includes teacher, admin, and a support staff from an entirely different school, a third party that adjudicates it, could ultimately make it through the expulsion review board with our school board. So that's kind of what the expulsion for discretionary process works. For academic centers, again, this process would lead to kind of that next level down. So this is where, major campus disruption. This is where, multiple fights on a campus. This is where there's a little bit more leeway. In general, we have some students who are there and are like a 9-week where they go to the academic center and then return to their comprehensive school in general for the academic centers.
I'm just going to interject my question because it's kind of goes with what you were just talking about. Are there any students currently who have been expelled from school and are not getting instruction now at all? Like, we've lost them.
Kevin McPartland, for the record. So when a school recommends a student for expulsion, so the student is suspended pending expulsion, so there still is connection to academic resources there through the school. When the student oftentimes there could be like a week gap between the enrollment in an alternative setting. But in general, no, when the students are expelled, they are still connected to whether it's an academic center, whether it's the NVLA academic center. Even when students are incarcerated, they're connected to instruction through there. So.
Thank you. And I wanted to get that on the record because I know that there was a lot of confusion even when we were passing this bill that we were somehow expelling kids and giving up on them, and that was the end of that. That is not what this restorative justice is. Helping keep kids in when they can, but if it gets to that point, we have to find an alternative to keep everyone safe. Okay, thank you. I just wanted to get that on the record. Next, Senator Dondera-Loop.
Thank you, Madam Chair, and I probably won't be as astute as the two student interviewers the other night, but I'll try. Tagging on to what the chair just said, who monitors them when they're in a virtual setting? So if they're home or they're not incarcerated, but they're home and they're on the virtual setting, is there any monitoring, or is it just if they don't show up, there's some touch point?
Mike Barton for the record. Thank you, Senator. It's a great question as far as how we provide that support in a virtual environment. I know that our principal at Nevada Learning Academy that oversees that academic center has a group of social workers, counselors. So while there's that virtual interaction, if they feel like a student's not engaging, there's definitely aggressive attempts to reach that family, that student, through a social worker, counselor. And I know that Mr. Martin at Nevada Learning Academy also works closely with Mr. McPartland to ensure that we activate that engagement at the home level.
Thank you. And then a couple short questions here. When you said that the cultural competency is growing, what's the final number?
Thank you, Senator. Mike Barton for the record. While we continue to track this year, the deadline for cultural competency training is June to finish that training. So we predict that will be our employee number, which is approximately over 40,000 employees that will be trained in cultural competency by June.
So we're about halfway through.
We're
Sort
about
of,
56% based
Okay.
on our latest data poll.
Thank you. And then you said that there were 10 schools and 10 classrooms that were models, but then later on I heard 50. Am I right? Did I hear that right?
Mike Barton for the record. Senator, yeah, there's a lot going on in the work of restorative practice. So a couple of things. The 50 schools, that's the target of our newest grant, the PDRJ grant that we're actually kicking off today. So there's a target of 50 schools participating in that series of trainings that will occur for the next few months. The model schools and the model classrooms are aligned to the original the IIRP work with International Institute for Restorative Practices. We've identified those schools that have done really well with our RLTs, our restorative leadership teams, that are probably ahead as far as implementation and doing this very well and effectively in classrooms. So that's the differentiation, Senator.
And can you tell us what which schools are involved right now? And are they training students and staff, or just staff? Who's actually being trained?
Sam Scavello for the record. Right now we are working with schools. I don't have the actual list with me right now. However, the staff is training. We implemented a trainer model. So the staff, and you heard Dr. Barton speak of the culturally inclusive champions. They are also restorative practices trainers because they've not only completed the initial training, which is 13-hour training, they've done an additional 20-hour training. So they've done 33 hours of training in order to be a restorative practices trainer. Then they come back to the school and they incrementally train the rest of the staff. And that's what's going on right now at the model schools. Also, the in-person coaching, we're at the infancy stage of launching that. But the in-person coaching from an IRP practitioner and expert is actually going on in terms of identifying those particular restorative leadership teams and working with those CICs and with the administration of that school. So it's not a cookie cutter. They look at when they do their training. It may be during a PLC, it may be after school, but they identify protected time and when they are going to train their staff using the IRP curriculum.
Thank you very much. So my understanding, the students don't necessarily get trained, it's just staff?
No. Oh, sorry. Sam Scribella for the record. Students are in the purview of being trained. We're not there yet.
Okay.
But it is in order for a school to meet and master restorative practices, then we should be incorporating a parent and parent groups as well as students in the training. So a school is considered meeting and mastering restorative practices when you have those other stakeholder groups involved. And that does involve students because part of the restorative practices implementation, we're in year 3, is that we will have some student-led restorative processes being conducted in our schools.
Perfect.
So.
Thank you. Thank you. I don't believe we've met, but I spent 30 years in the school district, so I know just enough to be dangerous. So, no, I'm going to stop and I'm going to let somebody else ask a question. Thank you very much.
If you could send me the 10 schools and then the 50 that are starting today, and I'm just curious if you can tell me, are they high schools? What's the percentage of high school and et cetera?
Thank you, Chair. We can definitely get you the full list. When we went through the assessment to see where they were, and again, as Dr. Scavella alluded, those schools that are model schools have met or mastered on that rubric. It's multifaceted. Elementary, we also ensure that it was multiple regions represented, so we can get you the list so you can see the full big picture. But there's definitely, I don't think there's a overarching percentage that are secondary versus middle school and elementary, but we can get you the full list.
Assemblyman De Silva.
Just a very quick question, Madam Chair. I had a question about the Star On programming. So how is that looking right now? I know that the program was implemented just as the pandemic hit and that there was some tumult there. But I was just wondering if you could give us an assessment as to how the program is operating now in the school district. Thank you.
Kevin McPartland for the record. Thank you for the question. So, yeah, the Star On program in my time in ESD, which has been about 8 months, one of the things that we're trying to do is really identify best practices because we did have schools that kind of were developing their own plans, and so we had them kind of evaluating and assessing the data on that to come up with some best practices. So now, as we provide some support to schools through the Hope Squared funding to operate the program, but we have a model now which it was what I described, which is, you have an area, a program where students are kind of in there throughout the day and teachers rotate out to them. So that's kind of the model that we're expanding now and supporting schools in.
We'll go up north to Assemblywoman Anderson, who has 2 questions.
I only get 2, but it's very nice to meet you. Thank you all for presenting today. My first question has to do with the training, which is found on page 3, slide 3. When you say the employees, this is paid as well for our education support professionals, correct? Just want to verify that because I know that has been a source of contention at times.
Mike Barton for the record. Thank you for the question. That does include our education support professionals.
And again, it is paid time for them, right? They do not have to do this, donate the time back to the school district.
That's correct, and they can do it on their contract time as well.
Great. Thank you for that clarification. And then my other question had to do with slide 9, in particular the reentry plans. I know, and I just verified with Assemblymember Hansen about this, of when we went through this process and how many discussions there were. I'm just making sure that those reentry plans, there is a clear discussion with the student, with the guardians, and with the educators that are involved and what needs to change, possibly at the new school site or at the similar school site. Is that the current process? Is that in policy, or is that something that it is assumed that the administrators know to utilize?
Kevin McPartland for the record. Thank you for the question. So the reentry plans is definitely something that we are tightening up with our new code of conduct that's going to be released for next fall. It's delineated in there exactly what's expected to be in the reentry plans. We have trainings that are rolling out actually starting next week, and then a full set in the summer to launch before the opening of the school year, so it's very clear what the expectations are of the reentry plans.
Thank you so much for that. So just to verify, this will be starting in the next school year. Right now, there might be 1 or 2 school sites utilizing it, but it is not consistently across the district. But the plan is next year for it to be across the district.
Kevin McPartland for the record. Reentry plans exist, but in different format, in different levels, and we're going to make sure that's more consistent throughout moving forward, yes.
Thank you so much for that clarification, because I think, as we all know, we do have many of our students that are, transient between numerous school sites at the same district, so having that consistency would be nice. Thank you, Chair, for allowing me to ask my many questions.
With that, I think you're good. Thank you very much. And I will look forward to getting those schools. Thank you. And if you just send it to committee secretary, and I'll get it out to everyone. Thank you. Nice to see you all. Okay. So now we will go back to Veronica Marr with NDE. Are you here? Oh, there you are. Yes. I knew I saw you. Please go ahead when ready.
Deputy McGill is going to be running the slide presentation. Is it available?
This is Christy McGill. It's up on our end. They're just connecting it now.
Perfect. Thank you. All right. Veronica Maurer for the record. Hello, Chair Bill Ray Axelrod and committee. My name is Veronica Maurer. I'm the School Climate and Equity Education Programs Professional for the Office of a Safe and Respectful Learning Environment. My work primarily relates to school climate, discipline, and restorative justice practices. I am delighted to have this opportunity to speak to you today and share what our small but mighty team has done to provide resources, training, and support with Nevada's educators. And I would like to thank CCSD for their testimony and sharing the wonderful work that they are doing for our students. We will begin with a brief overview. Next slide, please. Thank you. Nope, sorry, go back. Thank you. We will begin with a brief overview of the 2023 legislative changes addressing behavior, discipline, and school climate. Then I will share what the Nevada Department of Education has done and will continue to do to support districts and schools in addressing discipline disproportionality. Two bills related, next slide, yeah, right there. Two bills related to school discipline and restorative justice practices were passed during the 2023 legislative session. The bills amended existing law on behavior and discipline by changing the age requirements for suspensions and expulsions, combining discipline and restorative justice, and improving school climate, culture, and safety. One might ask, well, how are those working together? Combining progressive discipline with restorative approaches when addressing behavior is intended to prevent a reoccurrence of inappropriate behavior by helping students take responsibility for their actions, repair any harm, and collectively find solutions to restore relationships. Fact is, most researchers have concluded that years of punitive discipline measures have produced harmful consequences for students and suspending students are more likely to fail courses and become chronically absent, according to Hammond. Next slide, please. As mentioned on the previous slide, one of the changes in Assembly Bill 285 and 330 was addressing training to improve school climate of Nevada schools. Discipline disparities is a Tier 1 universal concern in our state. Although we have a ways to go to reduce discipline disparities, it is imperative to understand that implementing restorative justice practices is much more than how we respond or administer consequences for discipline offenses. According to the International Institute for Restorative Practices, or IIRP, as you heard in the other presentation, 80% of our efforts should consist of proactive approaches that contribute to the well-being of all students, to create a positive, inclusive educational environment. So as you can see, this chart shows professional learning opportunities our team provided during the 2022-23 school year. Notice the first training at the top of this chart. Our restorative practices and social and emotional learning specialists continue to contribute to the needs of our staff to support building positive relationships and understanding that connections can reduce negative behavior and teach the whole child. Next slide, please. Here's another chart that shows our 23-24 restorative justice practices professional learning. Some of them consist of trainings utilizing the IIRP's training model. The International Institute for Restorative Practices is the world's first accredited graduate school that specializes in studying the field of restorative practices. There, at the very bottom, Link Springs is an asynchronous professional learning and coaching online platform that our department has made available for educator knowledge and practice. With the support of the Link Springs team, we've created the School Climate and Equity Playlists, or modules. This playlist is used to support educators in building equitable and student-centered classrooms. Please keep in mind that this chart does not include all the additional trainings offered by our UNR's Positive Behavior Support Interventions and Positive Behaviors Intervention and Support Technical Assistance Center, nor does it include our social and emotional learning trainings, trauma-informed modules, or verbal de-escalation trainings. I'm excited to announce that NDE's Restorative Justice Practice Framework Curriculum and Training will be available for the 24-25 school year. As we take a closer look, next slide, please. Thank you. As we take a closer look at the state discipline data, here we have our rates of expulsions among federally identified race and ethnicities, and their enrollment rates during the 21-22 and 23-24 school years. Take a look at the blue column. This column represents the rate of enrollment. The orange column represents expulsions during the 21-22 school year, and the green column represents the expulsions during the 22-23 school year. One obvious concern with our state percentages by race and ethnicity is that the enrollment of Black students made up 12.15% of our student population during the 21-22 school year and 12.35% of our student population during the 22-23 school year. Still, our Black student population accounted for 38.14% of the expulsions in the 21-22 and 36.27% of the expulsions during the 22-23 school year. There was an approximate 2% decrease in expulsions. Next slide. Here we have our suspension data for 7 student groups and their enrollment rates over 2 years. One concern within our state percentages by student group is that students on free and reduced price lunch, third column from the left, accounted for 79.12% of our student population during the 21-22 school year, but made up 94.81% of our suspensions as represented by the orange bar. During the 22-23 school year, the enrollment rate was 80.65%, and yet students on free and reduced price lunch accounted for 88.34% of suspensions during the 22-23 school year, as represented by the green bar. There was an approximate 6% decrease in suspensions for students on free and reduced price lunch. It is important to share that both our English language learners and students on IEPs also show concerns with suspension rates. It is our goal to see a continual decrease in discipline disproportionality through restorative justice practices. Knowledge, training, implementation, and quarterly reporting requirements can help support this need. Next slide, please. In partnership with the American Institute for Research, Nevada's Department of Education administers the Nevada School Climate Social and Emotional Learning Survey annually. We also provide an optional spring survey as well. Did you know that 65% of the students at a particular high school disagreed or strongly disagreed with this statement? I feel like I am a part of this school. School climate refers to the overall atmosphere and environment within a school that affects the social and emotional and academic well-being of students and staff according to the National Center on Safe and Supportive Learning Environments. As you can see from this slide, we have a consistency of what our students say about how they feel when it comes to emotional safety. Although all of the categories, cultural and linguistic competence, relationships, emotional safety, and physical safety, are within the favorable to most favorable range, there's a consistent trend of our students saying emotional safety is where they need the most support. Are we really listening to the voice of our students? Emotional safety refers to the range of experiences in which an individual feels open to express emotions, trust those around them, exhibits confidence, and feels excited to try something new. Students who feel emotionally safe do not dread humiliation, embarrassment, or shame. Restorative practices support the need and the voice of our students feel emotionally safe at school. We want to give our students a seat at the table, but it's time for our students to have a table. Next slide, please. As you can see, looking at the school climate data, this is our state survey for staff. This is an optional survey for staff. And as you can see from this chart, in 2021, we had 1,252 surveys done by staff, and then fall 2023, 4,051. So there has been some improvements. There is consistency when we look at the data from spring 2021 to fall 2022, where our staff say that relationships is where we want to make sure we focus our attention for our staff. Relationships are the links and interactions between and among students, adults, and peers in a school setting. Sound relationships reinforce existing feelings of connectedness to the school community. The foundation of restorative justice practices implementation is relationships and connections. I am happy to announce that our school climate standards for excellence can be found on our Nevada School Climate Social and Emotional Survey reports. The new criterion-based standards provide educators with richer, more actionable information. Are you aware that Nevada is the first state to be able to compare school climate data statewide? Next slide, please. Here is a quick look at the professional learning opportunities our team provides. District leaders and administrators are welcome to use our training request form to request trainings on school climate universal supports. The professional learning menu consists of customizable school climate trainings based on the survey data. Some of you might be wondering, what does implementation look like in a school after completing a restorative justice practice training? Well, I'll share. You might walk into a school and see a quick 5-minute connection circle of students sharing examples about their favorite sport or learning what they have in common with their classmates. Or while attending a local high school's town hall meeting, you might hear the voice of students, teachers, administrators, and other educators gather to share concerns about the climate and culture of their school while discussing solutions. You might even walk into a school and hear into a kindergarten classroom and hear kinder students in a problem-solving circle, with students being able to think through solutions on classroom disruptions. Or you might even witness a trained volunteer peer mentor leaning in to help mediate conflicts between peers at a middle school. Next slide, please. Here are the additional trainings offered in collaboration with our partners. I do think it's important to note that our monthly restorative justice community of practice provides an opportunity for educators to engage in conversations, hear from school teams, learn about professional learning offerings, and hear from experts on implementing restorative justice practices. Next slide. Additionally, $2 million in ESSER 3 progressive discipline based on restorative justice funds were recently awarded for decreasing discipline disparities. 99% of the restorative plans were submitted to NDE for the 2023-24 school year. Connections are being made with students throughout our state, but I must highlight that a school is being intentional about building relationships with students by completing over 4,000 connection circles within one school year. Next slide, please. NDE and UNR collaborated to provide schools with an AB 285 quarterly reporting template that calculates discipline disparities. Our goal is to help schools see where there are disparities so that we can provide a systematic equity review in partnership with West Ed. Next slide, please. It is also our goal within the Office for a Safe and Respectful Learning Environment to meet districts and schools where they are by continuing to offer on-demand learning opportunities, asynchronous learning, as well as need-based training. We will continue connecting with our districts and colleges and community organizations like My Brother's Keeper, the Children Advocacy Alliance, NCASE, Nevada After School Network, Restorative Nevada, on creating solutions to keep students in school and to see a decrease in discipline disproportionality. Our team will continue to work on the foundation that has been set to infuse restorative practices and improve Nevada school climate. But there is a need for long-term funding so that we can allow districts can continue the work that they have started in building capacity. In closing, positive relationships with peers and supportive teachers are the two most common reasons why students enjoy going to school. National Center on Education Statistics. At this time, I welcome any questions.
Thank you for the presentation. I'm sorry, some of the members didn't have the correct slides, so sorry if there's a little chaos going on up here, but okay, now I think we're all good now. Okay, do we have any questions now that you have questions? Okay, you can sit back.
All right, thank you.
And then we will go finally to Russell Klein, Lander County School District Superintendent, representing the Nevada Association of School Superintendents in Carson City. And I appreciate you driving in for this. Mr. Klein?
Thank you, Madam Chair. Bill Bray Axelrod. For the
I
record.
apologize. Do we also have Dr. Paul? Oh, sorry. Yes, there you are. Sorry.
I'm
Go
here,
ahead.
but I can't find the presentation on the screen, so give me 1 second, please.
For the record, we have Dr. Paul Lamaruca with Washoe County School District. Russell Klein from Lander is coming up next. Apologize.
Thank you. This is Paul Lamarck. I'm the Chief Student Family Supports Officer with the Washoe County School District. I promise to be brief. I'm going to speak to the implementation of Assembly Bills 285 and 330, and we'll provide some context around restorative practices. I'll skip through here. There were major changes brought through AB 285 and 330 that kind of created significant change within the school district. Of course, there were changes to how we treat first offense batteries and distribution of controlled substances, changes to age-related distinctions that had come forward in 2019, 2021. Some changes with respect to district progressive discipline plans, especially around timing of those. Student support plans for any students that were suspended for more than 2 days, whether that be in-school suspension or out-of-school suspension, and then some of the data review cycles that have created changes within the district. So in terms of implementation, we had been feverishly reworking our discipline plan within the school district all last school year, anticipating changes we hope to see come forward through 285 and 330, and we were very thankful that those bills passed. We had more than 150 stakeholders contribute to the change in our discipline plan, and that was adopted by our Board of Trustees in early September of 2024. We also have all of our schools that are fully compliant with their local progressive discipline committees. That's made up of administrators, teachers, classified staff. They deal with temporary alternative placement.